Good afternoon, everyone. It is a brain in a vat again. Hope all of you are doing well today or this evening, depending on your time zone. Thanks for showing up. Hi, Crime Curious. We'll give it a few minutes to see if some people come in. To anyone who participated in the Mega Friday cocktail live and discussion, thanks. It was a lovely evening. Had a lot of fun with you guys. Hi, Allie. Thank you for asking. Yeah, we're well. I'll bring up Dr. T in a minute. She's currently in the background, backstage. So yeah, thanks for everyone who came last night. It was very interesting. Hello, Cash Gurnan. Hello, Undead. We had a really nice early conversation about the turmoil in this space and the new rumor mill and conspiracy theories that are being, as I say, the putrid true crime sausage being made in real time from all of the bad actor channels. Hello, Undead, Celestial, Faithful, Andrea. I hope you got a good night's sleep. I know you were with us until the end last night. That was a wild one. I um, I ended up privating it because it was a just a personal, informal live, and I don't trust the internet. We had a lot of very honest conversations, and because I don't trust these bad actors, I decided to just make it private. But of course, to all my friends and anybody, everyone that I trust, I'd be more than happy to probably drop you a link and figure out how to make a private video available to you if you ever want to listen. It was rather long. Hello, Dare to be Different, Celestial. We'll wait a bit more. So today, we're going to have a conversation which certainly Dr. T and I have discussed ad nauseum over the last decade about what is commonly referred to in our neck of the woods as anti-psychiatry. It's closely related to and essentially um, mental illness denialism, a very old concept across time where mental illness has always held a certain stigmatism, and we'd like to address the topic, and hopefully we will treat it fairly. We'll address some of the legitimate criticisms, or at least valid arguments that deserve to be treated fairly, and we will also then go over relativism in all of its forms: intellectual relativism, moral relativism, cultural relativism. I happen to think that relativism is the scourge of civilization, and something that impinges our ability to make more progress in this world and to be more compassionate and more honest about how the universe works. And I will then, I think, bring up Dr. T. Everybody, please treat my guest with the utmost kindness, and any mods in the room, please make sure that any troublemakers get wished into the cornfield, or at least get an admonition from you to stay on topic and to be fair. And I don't even know if I have a mod in the room at this moment. Let me go take a look. Actually, I might have to throw down. Um, Andrea, would you be willing to hold a wrench for me, at least until other people get in here? You certainly do not need to, but I'd appreciate help. Crime Curious? Sure, okay, thank you. Thanks to both of you. I'll add um, you both. Thank you so much. I really appreciate it. Just again, fair criticism and questions are all welcomed here, but it is important that we stick to the topic. So as I tell everyone, if somebody changes the topic, just ask them kindly to stick to the topic, and a second time, warn them maybe a bit more sternly, and then if they still are a bit disruptive to the chat, feel free to wish them away to the cornfield. And I wish them well. people contact me behind the scenes and say, that wasn't fair. You shouldn't have banned me. I was just whatever. I have the right to an opinion. I'm more than happy to unblock people if they can contact me and demonstrate that, they'd like to participate and whatever. They just made a mistake or they disagree with me. Anyway, I will now bring up Dr. T. Dr. T, how are you today?
Hello, good afternoon, good evening, and good night. As people said in the Truman Show, because I have no idea where you people are.
I think that's better than mine. I'm always good evening, good morning. I don't know what time zone you are. So everyone, please,
It works for everything. Hi,
please,
Ali. Hi,
thank you, everyone.
Casker. Yeah, I'm not gonna say all that. I'm gonna mess it up. It always gives me anxiety reading handles because I know I'm gonna mess them up.
By the way, your audio is so much better. I'm glad that we figured out what worked.
Yep, phones for the win. They make them
Yeah.
so much better these days.
So yeah, let's see how should I start it? I think for anyone that doesn't know, Dr. T, she is currently an MD. She's working in a psychiatric clinic, a psychiatric hospital, and she is beginning her residency in psychiatry. And so she's well situated to have this conversation. And Dr. T, what do you think? Should I just sort of read that section from the article, just to sort of get us situated in terms of what the context is? Okay, I'm going to sort of try to
It's
skim.
a good introduction.
I don't want to bore you with a long verbatim read of an article, but just to get us started. So, what is anti-psychiatry? Beginning in the 1960s, a movement called Anti-Psychiatry claimed that psychiatric patients are not ill, but are individuals that are misfits in society and therefore put into asylums. Adherents of this movement often refer to the myth of mental illness, after Dr. Thomas Szasz' controversial book, The Myth of Mental Illness. Origins of anti-psychiatry. The term anti-psychiatry was first used by David Cooper in 1967 through opposition to either psychiatry in general or its practices, and it predates this coinage. Surrealism's opposition to psychiatry predates it by decades. Leading lights of the anti-psychiatry movement, including Thomas Szasz and R.D. Laing, both psychiatrists. Other critics of psychiatry often associated with the anti-psychiatry movement include Dr. Peter Breggin and Jeffrey Moussaieff-Masson, a psychoanalyst who uncovered evidence that Sigmund Freud had suppressed observations of child sexual abuse. Civil libertarianism has opposed psychiatry or abuses of psychiatry on constitutional or other legal grounds. Among popular movements against psychiatry are the psychiatric survivors movement, persons charged with abuse based on repressed memories, political prisoners of totalitarian regimes, and certain documenters of the Nazi Holocaust. The latter point the latter point out that systematic euthanasia of people in German institutions in the 1930s provided the institutional, procedural, and doctrinal origins of racial mass murder of the 1940s. The Nuremberg trials convicted a number of physicians, mostly psychiatrists, who held key positions in both eras of Nazi murder. A sermon against the earlier practice by Bishop August Clemens Graf von Galen of Munster, delivered on August 3, 1941, is credited with inspiring a group of young medical students to publish anti-Hitler pamphlets in 1942 and 1943 in the name of White Rose. Cooper was a Marxist, and indeed there has been a great challenge to conventional theories of psychiatry from Western believers in Marxism, but the anti-psychiatry movement is by no means homogeneous ideologically, and Szasz approached anti-psychiatry from a civil libertarian perspective and challenged Cooper's Marxist beliefs. Many of their criticisms derive from the inhumane treatment of mental patients, either through the damaging effects of long-term institutionalization or the use of specific interventions given without informed consent. Electroconvulsive therapy, or ECT, has been used to sedate and punish difficult psychiatric patients rather than for therapeutic purposes. Others contend that even accepted therapeutic practices remain instruments of social control. Punitive use of treatment, including ECT, isolation, and restraint, has diminished, but it is still widely documented to occur. There has been a resurgence of ECT research and treatment in the past decade for treatment of a wide range of mental illnesses, including severe depression, but many things about ECT are still poorly understood, including exactly how ECT works, and opponents of the practice allege that ECT causes brain damage and has killed several patients on whom it was used, some without their consent. Others object to psychiatry not on these grounds, but on the grounds of the fact that the body of information making up the discipline consists mostly of vague and non-falsifiable hypotheses, or worse, hypotheses not testable without resorting to unconscionable and inhumane experiments on human beings. As Karl Popper noted, if it isn't falsifiable, it isn't empirically testable, and if it isn't empirically testable, it is not science at all. The discovery arguments against anti-psychiatry, the discovery of evidence suggestive of biological and genetic bases for some mental illnesses has eroded support for the more extreme claim among portions of the anti-psychiatric movement that mental illness is more a social label than a biological disorder, but such claims persist. So I'm going to leave it at that because I'd like to address some of these criticisms. I'd like you to help us address some of these criticisms, and then I definitely want to have the discussion with you about how we ground psychiatry in empiricism and ultimately respond to Popper's conversation about falsifiability, which essentially reduces to whether or not we can call this science, whether or not it's empirically based, and for you to then discuss all these things with us. So please give us your feedback.
When it comes, before we get into that, when it comes to what anti-psychiatry is, we also need to talk about movies, because of course invariably the psychiatrist is the bad person in movies. Almost always the person who is experiencing something that we would call mental illness is actually, either in touch with a higher power, or they have magical abilities that nobody else understands, this sort of thing. And if you actually notice that pattern, it's a very common pattern. It's almost always represented like this.
So again,
which I think when it comes to just common knowledge, what people believe about it, this is what they've seen. They've seen about psychiatrists torturing people, shocking them, mistreating them, and basically not believing them when people tell them that they've experienced something magical.
Yeah,
and
so
invariably, they're not psychotic. They're actually correct, and the psychiatrist is always the damn ass. Sorry.
No, so again, we can, as usual, modern movies can also represent in a consistent fashion a lot of and reinforce a lot of bad ideas that we have in society. Also, another point that we discussed before was that clearly anti-psychiatry predates this modern movement that we just discussed and goes back, as far as we wish to go. Obviously, a lot of persecution was done against mental illness in the context of religion. So often was discussed in the context of being possessed by demons, or representing evil, or representing other superstitious beliefs, and they had experienced a lot of very inhumane treatment over time from prior moral systems and religious beliefs. And you might want to add to that.
Yeah, well, basically, I mean, obviously there's so many doors to open here. It's just, yeah.
Right.
I have a lot of feelings and thoughts. But the first thing I would say is that when we talk about mental illness, let's talk about the most obvious thing you see with mental illness, which is psychotic episodes. So it's a person talking to themselves, yelling, screaming, answering to voices in their head, talking on their own, this kind of very loud presentation of a state. Under any circumstances, this is scary to watch. It's scary to watch a person you know go through it. It's scary to watch somebody you don't know. It's always been scary across history to see something like that. It makes you very uncomfortable, unhappy, and scared, and that makes sense. So obviously, if you think about just that fact, it makes sense that before we had any kind of understanding about the brain, people would see this and would say, this person's soul is not working right, is possessed by something, something is trying to break it, something really bad is happening. And the only tools I have in understanding it is, supernatural ideas, gods, demons, angels, all that sort of thing. So this is the very first thing to understand. It's a very emotional process to see somebody who doesn't seem hurt. They're not bleeding, they're not dying, they're not hurt in any other way, but something really bad is happening to them and you can't explain it.
Right. So we not only have just sort of the fear aspect of humanity, seeing behavior which is anomalous and not understanding it, which then feeds, dehumanization and scapegoating and being able to justify harming these people. We also discussed before the notion of the soul and essentially beliefs in free will and personal responsibility, that these people are then somehow, you know, doing it on purpose, or they have some sort of conscious agenda, as opposed to it being something which is happening and dysfunctional in their brain.
Yeah, exactly. So obviously what these people did is like, what are you going to do? You're going to perform an exorcist, you're going to throw holy water at them, and in extreme cases, you're going to drill holes in their brain because you think that this is going to give a door for the demons to fly away. I mean, there is a reasoning behind this. It's not good or sound. It's not based in anything that is
or
actually correct, but
or
there is
just
a reasoning informed by these ideas that you hold
right,
about how the universe works, right?
or just throw them in the dungeon and chain them up as a monster.
Yeah, just get them out of sight, out of mind. They're disruptive and they scare you, and the only thing you can do is, either what? Murder them or hide them somewhere. And literally, you have nothing else you can do because there have been times where there was nothing else that you could do. So this
Uh,
brings us to psychiatry. And basically, what people don't understand is that scientific psychiatry exists for only like a couple hundred years. And medication, actual effective medication, has only been around for like 80 years, I think not even 100 years. So we've never had this ability before in the entire history of our species to have a person having a full psychotic break and be able to stop it. We've only been able to do this the last 80 years. That's
right,
very impressive, by the way. We should be
absolutely.
proud of ourselves for getting here. And we also need to understand that we have not perfected this process by any means of the imagination. Clearly, there's a lot of room for improvement, but we have done something right.
Right. So in that context, then, from a humanist perspective, modern medicine, its goal is to minimize harm, help people achieve a higher quality of life, and address suffering to the extent that modern science can intervene and help it. And in that context, then, we have to recognize that we've made leaps and bounds in being able to help people, but that the science is still very much in its infancy, relatively speaking, and that yeah, that we don't know everything. The brain is highly complex, and there are individual distinctions, and so we still have a long way to go, but we've made a lot of progress. I wanted to bring up, I often talk about it in the context of diagnosing mental illness in the context of dysfunctionality. And so, until essentially somebody is not able to maintain normal relationships, get up, take care of themselves, feed themselves, have be able to maintain a job, we sort of don't discuss it until it sort of reaches a certain threshold, which we might refer to as dysfunctionality. And then that is when we feel obliged to intervene in order to try to help. I don't know if that's important, if you want to address that topic.
Yeah, obviously this is a very big problem for diagnosing mental illness. Now, some things are very simple, like what I said. When you have a full-blown psychotic break, it is very easy to have people come together and agree this is a malformed brain. We need to do something to stop it. This isn't just a misfit, a person who's just different or something like that. The same way, if somebody has epilepsy, it's not that different. If you see like full-blown seizures, it's really not necessarily that different. There are a lot of similarities. But the thing is that when you get to more subtle things, it does get a bit fishier. And the first, like you said, the very first easy thing to say is when the person itself is experiencing unhappiness and dissatisfaction and all those things. So this is always a very simple thing. Like a person with anxiety is also the very big category of mental disorders. Um, Anxiety is very draining. So it's very easy for people who suffer it to come forward and say, excuse me, I need somebody to help me with this. And might first go to actual doctors because they might have panic attacks or things that, they might turn things into physical symptoms because their anxiety is untreated. They will get to you. They will get to the psychiatrist. So
To the
this
to
is,
the chat
again,
to,
a
to
sort
the
of,
chat room. We Sorry to cut you off. To the people in the chat, we will try to take a break and have we'll be able to ask Dr. T some questions. So yes, so please be patient. We'll definitely try to find some time, try to remember them, and then get our attention when we open it up to questions. Sorry to cut you off. I also wanted to. Do you want to address consent in this context?
yeah, just 1 second before consent,
Go
I
ahead,
would like to say that
please.
the third problem is when you're creating problems for other people, but you're not necessarily experiencing any particular trouble yourself. And this is where it becomes a little bit more difficult, let's say. So if you have somebody like what we call a psychopath, for example, you might have a person who's really hurting other people. They are going to be also incapable of making meaningful connections themselves, but they don't feel like they're missing out on anything because they don't think like they can have it
Neurotypical.
or that they even want it. So this is going to be sort of more difficult. You sort of have to use different criteria, which is again based on functionality, like you said, with regard to other people, but the person themselves might not be agreeing with you about what the problems are. They think they're right, the rest of the world is wrong, and good luck convincing them.
Right. So then maybe again, maybe this is then the moment to discuss maybe consent and intervention. When it's justifiable, and how we respect civil liberties, and how complex this topic is in terms of our strong belief that people should be able to consent to any intervention, and yet obviously when they are at a threat of harm to themselves or to others, it's similar to other areas of where we discuss consent versus justifiable intervention. So I don't know how you want to approach that very delicate and complex conversation.
Yeah, I mean, this is obviously a very complex conversation, and this is where basically harm to others or harm to self is where it comes. So if you have a person who has committed who has attempted to commit suicide, or who's seriously considering committing suicide, you can go against their will and hospitalize them and give them treatment until they no longer want to hurt themselves. And some people are very uncomfortable with that, and I understand it. But when you can actually treat that, how can you justify letting people take their own lives? You know, how can you think that they can consent, they can choose to take their life if you know that if you treat them, they will stop feeling that way?
Now, how would you, in
And
terms of,
complex.
it's very complex in terms of ethics. We could discuss, assisted euthanasia as being an area where our modern moral intuitions respect the right of an individual to consent to their own demise, and yet that sort of contrast, for good reasons, from something like someone who's merely suicidal. How would you discuss that rather complex distinction?
I'm not sure I understood the question.
Well, that our moral modern intuitions suggest that there are conditions under which we respect someone's right to want to take their own life. In
Oh,
Europe, there are things like assisted euthanasia, and
yeah.
how that we
Well, the
distinguish
only thing I'm
between
going
that.
to say is that you need to prove that you're not depressed. So that tells you all you need to know. You need to actually not be suicidal, so to speak, the way we mean it in psychiatry. You have to be very logical about your choice to take your own life and not emotional about it, if I can just very,
Correct.
very simplify it. Because otherwise, they, you know, it's exactly it. We think that if you have depression, then we can probably treat it, make you feel better, and then you might change your mind.
Right.
Obviously, this is very,
In
it's
the
just
in the case in the case of
way too
assisted.
fishy. I'm not comfortable getting too much into this.
Understood. I would just argue that in the case of assisted euthanasia, they go through an entire psych evaluation to make sure that they truly understand their position and that they are truly consenting of, with full control of their psychological faculties. That would be the distinction. So yeah, I obviously just want to bring up that we need to probably talk about SSRIs and modern pharmacology, and I wanted to then, I don't know, unless you want to say some more, I wanted to bring up maybe how do we justify something like the DSM-5? How do we ground modern psychiatry in scientific principles and in empiricism, and ultimately respond to Popper's discussion about falsifiability?
Okay, so you
A
just
lot of
glossed
questions.
over all of pharmacology, and then
No,
you
no,
went like, oh, after
no,
talking about all of pharmacology,
no, I
let's
did
also
that.
talk about all of the philosophy of it.
Hold on. I wanted to only, it was more for my brain to remember to discuss these things. So let's
Yeah, that's
let's
okay. I'm not really sure where to get
yeah,
it.
let's
Um,
segregate all of those distinct complex topics, and you choose one if you think that that's a proper next segue, or if you'd like to take it in a different direction, by all means.
okay, so let's talk a little bit about pharmacology since it's something that people are really interested in and scared of, maybe in some ways. And there's also a lot of stigma associated to it. Like we said, effective pharmacology for psychiatry exists for less than 100 years. Um, the basic, well, there are three basic categories. We have the antipsychotics. We have um, anti-anxiety. Uh, by the way, you'll have to excuse me. I'm trying to find my English terminology.
Yeah,
I'm
yeah.
thinking Greek right now, so it
For
takes me a little bit
yeah,
more.
for everyone in the chat room, she's speaking to us in her non-mother tongue. So
Yeah. Um, and the third one is antidepressants. Well, I would say mood disorder medication, not just antidepressants. They can also be other things. So antipsychotics, like we said, are about psychosis. They're about all the things that we have associated with it, which, most usually is hallucinations, hearing voices. Very often it is also associated with thoughts of having people be after you, having people, tap your phone and put chips in your head, like microchips, and they're following you and all that. They want to hurt you. All of those paranoid delusions as well. These are the very common, simplified um, symptoms against which antipsychotics have been very effective. Now there have been a lot of generations of those medications. They have some, pretty important side effects depending on which substance you use. And the problem, of course, is that we don't have a cure. It is something like diabetes or cholesterol. The type of treatments we have right now for psychosis is the type that you get things under control if you take your medication. And if you take your medication, you can be well and functioning and have a good productive life. But we don't have this kind of take it for 2 months and like the antibiotic regimen, which is 10 days and then you're done and that's it. So that's one of the reasons why people are unhappy with uh, psychiatric medications, because they're longer regimens. They're not something that you will see an effect as fast as other medications. Um, so yeah. Now the anti-anxiety meds, they're very fast forward. They're basically mild sedatives.
What do you mean by, sorry, what do you mean by fast forward?
What?
What do you what
What did I say?
you said fast forward. What do you mean by fast
I
forward?
meant going past,
Th-
this part of the conversation of antipsychotics,
Oh,
going to the second category of drugs.
understood.
So basically, this, very important big part of medication is just um, sedatives. They calm people down, but those substances are addictive, so they're not meant to be long term. They're meant to be used for when things get really fishy, for when people are having a very hard time. Take it for a short amount of time, and then you want people to get off them. That's not something you want them to be taking permanently, and that's kind of malpractice. Actually, it's a very important thing. It's a very easy answer, because if you give sedatives to somebody, of course they're going to be calmer, but it's definitely not the right thing to do. You're not meant to treat a medical
But
disease using
uh,
those sedatives.
I'm going to intervene again, not for you, but for me, to remember that we might want to talk about just your position on general medical ethics and treatment when it comes to psychiatry, in terms of how you go about thinking about the ethics of any particular treatment, and we can discuss it at any point. I just wanted to just throw it out there. I mean, you're essentially showing us some of those things as part of your discussion, but I don't know if you want to parse it out as a unique topic later. But I don't want to take
Yeah.
away from your train of thought. So please continue with the pharmacology. You know me.
Good luck with that. The train is gone.
You know
No,
me.
that's fine. And yeah, I don't want to spend too much time on the pharmacology sector, just to, you know, go through the most important points. The other big category are, mood disorder related medication. The most important are antidepressants. The first ones were very, very effective, but they had pretty serious side effects, which is why we don't use them very much. And that's how we ended up with SSRIs. Um, they're a little less effective, actually, but they are much better tolerated, which is why, the medication we pick these days. They do have the side effects. I saw that somebody mentioned, weight gain. Unfortunately, many, I would say quite a few psychiatric medication have that as a side effect. It's something you actually need to, as a doctor, you can't just ignore it. It's something you need to work with a patient to see if maybe you can try a different substance, or maybe they can um, combine it with some changes in the way of life, and or managing their expectations about it and making them sort of move more towards acceptance, or it's a very delicate balance. It's something you need to work with them. It's very unfortunate, and hopefully, again, I'm sure we're going to end up with some better solutions in the long term.
Okay, so the 800-pound gorilla question, and then also if you could maybe discuss the complexity of getting the right dosage, having to possibly go through a bit of trial and error to get the right, sometimes even a cocktail, which works best for one person. So certain medications work better for some people, some work better for other people, and very often the initial stage is essentially a bit of a trial and error to make sure that we are
Absolutely.
adjusting everything perfectly, and then I'll ask the 800
Absolutely.
800
So,
pound gorilla afterwards.
yeah, actually, I saw a comment earlier and I forgot to answer it. When I said that psychosis looks like epilepsy, I didn't mean actually physically. I said in terms that when somebody is having an epileptic seizure, you can't talk to them and have them consent, and you can't get through to them. You don't really have this kind of, you're seeing a brain malfunction. That's sort of the point I had. So, in the same sense, actually, I like this example. For seizures, you also have it's called the medication criterion, which is, it's very hard actually sometimes to diagnose epilepsy. You might do a lot of ECGs, um, electro
Cardio,
cerebral
cerebral.
cerebral, because it's for the
Sorry.
brain.
Yeah.
Yeah. And you might not get them. You might not get the actual malfunction so that you can have the diagnosis. And what happens is that if you have a lot of other factors, that they're reporting it to you, you have other people corroborating, you have some other factors from their lab reports, you start with a medication and you see if it makes them feel better, if the seizures stop happening. So this is called the medication criterion,
The ET,
and it's when,
yeah, EEG. I just remember it's electroencephalograph, isn't it?
yes, thank you, yeah, that's correct, yeah, exactly. So yeah, the same thing could be said for a lot of psychiatric issues, that you just, basically, if it works, it works. So you try out a few things and you see what works with their body better. The same thing actually could be said about blood pressure medication. We actually are not good at treating high blood pressure. People don't understand that. They don't really talk about it that often because I don't know why, actually. I'm not really sure. But we have like 5 different categories of substances that can be used. And what works for one person might not work for the other person. We have all sorts of different combinations, for different situations. And in the end, it's just based on the particular patient. If it works on the particular patient, then you just keep it that way. And
And
you might
that
need to
just
change it in some time.
right. So, unfortunately, we do go through a bit of trial and error in order to get people sort of the right combination that works for them. And that's not taking away from the effectiveness or suggesting that we have no idea what we're doing. It's just that there are enough individual distinctions that's just
Yeah.
unfortunate part of the diagnosing and the treatment aspect of medicine at the stage we're
Actually,
at today.
we really need to talk about that because people seem to be very unhappy about the trial and error as a process. But for example, you can have that even with antibiotics. So, for example, you may start with an antibiotic. It might not work. You might have to switch. You might have to do a particular test to see if the particular bug you have, you know, can be killed by the particular antibiotic. Um, this is how it goes. This is, you have a very complex machine, and you have to try a few things to see which solution is going to work. And the same thing is actually true with computers. Everybody knows that. Troubleshooting actual machines and and computers and things like that. Uh, you know how that is. You have to try a few different solutions. It doesn't mean that you don't know what you're doing. It just means that it's a very complex
That's
um,
a perfect analogy, by
being,
the way.
you
By the
know,
way, yeah,
thing. It's a very complex thing. So I think people want simple answers. We really come back to that very often,
yeah.
and they don't do well when people tell them, "Oh, we tried this, it didn't go well. We have a second plan, and I think it's going to work better." And we immediately go like, "Maybe you don't know what you're doing."
Right. I mean, I'm as you said, we talk about this. I talk all the time about how humans are answer-seeking machines, and they want certainty. And so, when you're being epistemically humble, and you're only being able to give, for example, in scientific terms, probabilities about success, that frustrates a lot of brains because we evolved to want certainty and to want answers, and so a lot of people then use that uh, in anti-scientific views to suggest that if science doesn't know 100% with certainty and gets it right the first time, therefore it knows nothing, and this is sort of this appeal to relativism, not recognizing that that biological systems and brains are highly complex and it differs from individual to individual. And I think that from a scientific perspective, you really need to abandon the aspiration for certainty. The universe is not really, you know, does not seem to be built to afford us the opportunity to have certainty about pretty much anything. We go with what works, and we go with what statistically is probable. And so, you can attempt to fix a human being with an 85% success rate based on prior data, or you can go with the 15% chance that doing nothing is going to help humans, uh, you know, um, flourish. And you can take the 15% odds all day long, but I'll take the 85 all the way to the bank.
And I'm gonna go back to the responsibility of movies for this. The long shots, the underdog, they're always pushing us to believe and go against the grain, and even if it's not 1%, I'm gonna milk it for all there is. And all this is great and dandy, but it's not personal. You know what I mean?
Right,
When I
right.
come and offer you a solution that has 85% of being successful, I'm not being stupid. I'm not being, cynical. I'm just going by the simple odds.
And being
It's
honest,
not,
and being
and
honest.
being honest to you. I'm giving you the facts. So the problem is this push we have. Oh, if you really truly believe hard enough, the secret, you're going to manifest it. And
Right.
I
This is
blame the movies for that,
what I call
quite a bit actually.
the appeal to contrarianism or to relativism, which is so popular because people like to believe that their gut instinct or alternatives are in some way better to the mainstream, because this again appeals to conspiracy, that it's all about money and big pharma, and the doctors are all shills, and they're just here to control us and steal our money, and they're not being honest, and there are alternative means of fixing humans. So maybe I want to talk about the trade-off between solving a primary problem and and giving people higher quality of life, which may come with side effects, or more often than not, or pretty much all the time, comes with some trade-off. Because when you're messing with biological systems, you pull this lever, and you're going to have a consequence somewhere else in the system. But how essentially, if their quality of life is greatly enhanced, many of these people are more than happy to deal with a potential side effect. And of course, we're only statistically discussing side effects. Sometimes they don't manifest in any meaningful way, and sometimes we just accept them, but still on the whole, a person is very happy to accept the side
Yeah.
effects.
Um, I have, this is a very important conversation, but I need to bring up that first I want you to talk about your new fashion tank top according to seasons, because that has me laughing over here.
There were people were making fun of me and calling it like a toga, and I just don't have a clip, and I have a little stupid thing, and people
Well,
make fun
you
because
are
like
half Roman and half Italian, right? That's what you were
I,
saying when you were
I,
little.
I suppose. So talk about the side effects versus
Okay, so
primary,
here's the thing.
solution thing.
Here's the thing. Let's first talk about effects. And the thing is that you cannot have an effect without a side effect. And I don't think people understand that. This is, I don't know why people don't recognize that, and why it's not talked about more often. So, any kind of intervention you do to the body, if it has an actual effect, if it does anything to the body, it might have a potential side effect as well. Now, it might not be as, big a reaction. It might be less harmful than the good that we're doing, but the point is that you need to understand there is nothing you can do for good in the body that does not have potential side effects. So right off the bat, you start with a balance. You start with the scales, basically, and you start putting things one side, the other side, and you see where the balance is.
In terms of just
Um,
net improvements on the whole.
yes, exactly. And it's always like that. It's always like that. There isn't a no-brainer, 100% no risk, absolutely perfect. And actually, we've seen that with bad marketing. When they have those things that actually don't do anything, dare I say, yeah, exactly. I'm gonna say something like homeopathy. Well, of course, it doesn't have side effects because it's actually water. There's nothing in it, so you don't have side effects because you don't have effects. But
It's I like to
you know,
call it the nothingness.
the nothingness. I mean, unless it's actually spiked with actual substances, and then you can have stupid things like reactions to it, which is really dumb. But it happens. It has happened, and it's ironic to say the least. I'm looking for a nice way to put it. So yeah, so we start with those scales straight away. Um, Obviously, we value consent, and there's been this new idea of informed consent the last few decades. But of course, it's a very complicated thing because somebody has gone for many years to med school, and they've done the residency. They have all this experience, the personal experience. How exactly can you give all that information to somebody who doesn't know much about medicine?
Indeed.
That is actually a very complex problem because for me, it's statistics. For you, it's your life. So you don't care if it's a 99%. You care that you might just be the
The
unlucky
1%.
one out of 100. Yeah, and I get that. I understand that. It's hard not to feel that way when you're on the other side of medicine. Um, but in the end, you do your best to give all of the information to the person. You try to explain to them the pros and the cons, and there is no simple way to do this. It's really up to the individual, up to the particular circumstances of that individual.
Yeah, I mean, we've talked about this a lot. I find it a very fascinating and highly nuanced, complex conversation because, to your point, um, it relates to ethics, and it relates to also, obviously, doctors to the extent that they are better communicators. They can be more effective at transmitting information. If they're very clinical and they're using more highly technical vernacular that the patient then is ultimately not capable of understanding, or just the simple reality that a layperson is not going to necessarily truly, you can't, as you say, download 20, 30, hundreds of years of medical science into a layperson brain and have them truly synthesize and understand all the complexity. So from the perspective of the doctor, this question of how much information to provide and what is useful and is a very complex topic.
Oh, yeah. And if there is one big complaint I have about the medical community is that actually medical education is very much behind the times. Now, also, it sort of can't help it because medicine has changed so dramatically during the last century. There was no way for it to keep up. Nowadays we don't keep up. There isn't such a thing. There's so much information out there. It's not humanly possible to keep up. But medical education has not incorporated all those
Soft
skills of
skills,
communication.
the soft
Yeah.
skills.
Again, I really hate that they're called soft skills. We're social animals. These skills are as hard as anything else.
Right, it's just to
But
be
yeah,
distinguished from technical skills.
yeah.
So
I
before I
want a different term. We're going to come up with a different term.
understood, well, also in this, when I refer to the soft sciences, it's hard to use that word. It's just that's often used because it's by definition derogatory or you know
Social. Let's just use social. Social
so,
skills.
social skills.
Sciences.
Um, yeah, well, of course, that's another way to describe it, but it is often referred to as soft. So the 800-pound gorilla, uh, an old idea that still persists today. Antidepressants, SSRIs are turning human beings into zombies and taking away their soul and their personality and rendering them less human than they were before.
Well, the simplest answer is that then you would be seeing zombies all over you because there are quite a few people who are on SSRIs and you're interacting with them on a daily basis. And you don't seem to think they're zombies. So, again, there's been, to be more serious, there's been many generations of those medications. It's true the first ones were more, more. They were more. Um, Nowadays, no. Most, especially with antidepressants, I mean, it depends again on the dose you're taking, the seriousness of your episode, and of course the type of substance you're taking, and some other factors. But most people actually do not have a problem of, the zombie problem, and the people around them do not have that experience with them. Um, Not to mention, of course, that the changes these medications make, they're very slow. It's not something that happens overnight. So it's actually a very, what people often say, how they describe it is like as if slowly I was getting something lifted off me, like I'm feeling a little bit lighter, like slowly somebody's turning on the lights, getting from dimmer to lighter, for example. And it still has ups and downs. It still needs work. It still, in my opinion, needs psychotherapy um, to be working on the side, because we know that these things in combination, they give you better results. But yeah, I mean, the simple answer is, where are all these people? Where are all these zombies? Because I'm not seeing them.
Right. But to be fair, there are people who report that their constitution, some of their behavior is altered in a way that they're not perfectly happy with, correct? I mean, you would concede that.
I'm sorry, I was reading Jen's comment and I'm laughing. So yeah. Do I seem less human? No, you seem perfectly human to me. But yeah.
I might be the
Sorry,
only
what did you say?
I might be the only person in the room not on any medication. When you realize how many people around us are living their lives, they are far happier, and we mostly do not know that they're on some form of medication, and they are and they report in very large numbers that the quality of their life has been improved, and to your point, it feels like an anchor has been lifted from their shoulders in terms of feeling the existential angst that they might have been
Yeah.
carrying around prior.
I also want to comment that, again, it's not a one size fits all, so it's not going to work for everybody. And there is one thing I would say about antidepressants, which is that it can be easily used as a way to not have to try very hard as a doctor.
This is the possible
So,
overprescription aspect,
yeah.
or
By the
I wanted
way,
to bring that up.
that's not even just psychiatrists, because of course you have other
Well, I talked
disciplines.
about
I mean, I'm not
antibiotic.
sure that that's
I also talked about like antibiotic resistance in this context, that because of the success of antibiotics working in so many cases where we might not have we can't identify an infection, but that because they're so effective when things seem a bit asymptomatic, that then we have tended to overprescribe them. So they are a victim of their own success. And I think SSRIs can
yeah.
sort of have that
Yeah.
same sort of issue.
Yeah, and the thing is that, you go to your GP, you have like a 50-year-old woman with some generic other health issues. She's reporting some higher stress levels, lately, some family problems. It is easy for that GP to just go like, you know what, you get that antidepressant, it's very likely it's going to help you. And it's not even necessarily wrong. Now, is that best practice? No, it's not, because it's not addressing the situation in a best practice type of way. Um, Now, the interesting thing, it's really hard. We're talking about so many things here, but the interesting thing about psychiatry is that as a discipline, you have so much variety about how you do it. So you can have the whole spectrum of a full-blown Freudian psychoanalyst who does not prescribe medication and just does psychoanalysis, which lasts decades and decades, and they only have particular patients that they see them throughout their whole life. And you can go to all the other side of the spectrum, which is people who don't do psychotherapy at all. They actually don't believe in psychotherapy, which is also very interesting, and they just prescribe medication. Now, I would say most psychiatrists actually don't belong to the ends of the spectrum, which is good because I don't think this is where the best, information lies. I think we have pretty good information to think that psychiatry works best with a combination of both. And I think in the end, most psychiatrists actually lay somewhere there. So yeah, antidepressants can be sometimes used as,
Overprescribed.
I just, I don't necessarily have the ability to um, get
Quantify.
into it more. Yeah.
Oh, okay.
So,
Yeah.
yeah.
So yeah, I want to, before I forget, I want to bring up that maybe a very notable anti-psychiatry community are Scientologists. And the funny thing about that, if you look into why they're anti-psychiatry, it's essentially because of their whacked out superstitious beliefs written by a crazy science fiction writer turned cult leader, L. Ron Hubbard, who basically used a science fiction story about an ancient alien warlord named Xenu, and all of us being possessed by thetans, which are ancient alien souls that have somehow um, uh, gotten into our bodies, and we need to be disabused of these alien souls, and they use these e-meter pseudoscience tactics to essentially try to clean us or purge from us these poor disembodied souls from outer space. So very odd
Okay.
belief.
What did he say? What did he admit
Who?
after that? How,
Oh, the quote. I was going to bring it up, but basically something to the effect of, "You don't get rich writing science fiction. If you want to get rich, invent a religion."
exactly. So, since it was completely apparently.
He was a
Intentional.
he was a
It
fraud.
makes sense. Yeah, it makes sense that it was a very brilliant move. Of course, you want to be against psychiatrists because these are going to be the people that are going to be telling the followers of Scientology that, you know. So it
Yeah,
was actually a very brilliant scheme if you think about it. I mean,
on his part. Yeah,
very, very, very frustrating, but at the same time, you
quite
know,
clever.
yeah,
Yeah, so I thought
game
maybe,
game recognizes game, as we say these days.
yeah, unless you want to finish up on anything, I suggest maybe we take a bit of a break and refer to the chat, and hopefully you guys can remember the best questions if you've seen them earlier and you'd like to bring them back up, and Dr. T can answer them, and then after that little break, maybe we can get into the philosophy of science aspect in terms of how we can claim to know things in psychiatry and how we can ground that in empiricism and address the Popper's falsifiability principle. Is that fair?
Yeah. Okay.
Yo, I'd rather you not come up, but you're more than welcome to ask your questions from the chat. I mean, we can certainly have a talk after. I'll let Dr. T go off to bed because she's in Athens, Greece. But please ask your questions, and then you can certainly
Okay.
come
So
up
I'm
with
already
me later.
seeing a question by Crime Curious. Is wellness the desired effect of psychiatric medication, or is it compliance? Um, I mean, obviously, wellness is what we want as doctors and as psychiatrists. The first thing we want is for people to be um, well, happy, to be able to function, to have the ability to choose what life they want for themselves. The problem is that you can't really go for that well thing. You go for functionality. So, what you can give your patient is the ability to be more functional, and then they get to choose, or I mean, said another way, then they can do the work to build a good life on it, but there is no way to make them
Happy.
be well in that sense. You get them more functional. You get them be able to do more things. I can tell them what they will do. I'm just giving them the energy, the ability to function better. So that functionality can easily be seen as compliance in the sense that, you know, if a person cannot work because of how they're feeling, because of their anxiety, when I'm making them functional, I'm giving them the ability to do a 9 to 5. It's not up to me to decide how society is built when it comes to work and what it means to work. And, we can get into this whole philosophical situation about that. But I mean, even if somebody wants to um, be against that and maybe protest, they're going to be more able to have the energy to protest how society is built if they're functioning well. I don't know if you understand what I mean, because that was a little bit more complicated than
No,
it
no,
sounded
that makes
mine.
perfect sense. You can't guarantee wellness or happiness, but you can at least hopefully get them into a state, a better physiological and brain state to essentially at least allow them the opportunity to potentially acquire, a higher quality of life because they're more
Yeah.
functional. Um,
I would also like to say that actually I was anti-psychiatry when I was younger. I think I should have actually started off with that. I'm not sure why I didn't. But, I was all about the misfits, the whole idea of the anti-establishment thing, because I also saw the psychiatrists are as the enforcers. They're the enforcers of our brain. They're the brain police. And I understand why people see it that way. But I come back to that. We can give you your functionality, and then you can choose what you can do with it. I think that's, in the end, a good way to summarize it.
yeah, like in the context of if you have a broken leg, a doctor can't guarantee you're going to go win a 100-yard dash, but they can at least repair your leg, and then you can do with it what you're capable of doing. But at least you have a more functional leg.
Also, if I can make it more complicated,
To use
if
that
we can talk
analogy,
about yeah, if we can talk about the ethics of um, athletes and their lives and doping and all sorts of things, me as a doctor who fixes a broken bone is not apt to me to talk about those things. You make the decision whether you're going to run the marathon or not, if you want to stop or not. I'm just fixing your bone. I'm giving your functionality back. I'm not telling you what to do with it,
indeed.
right?
So, yeah. So are there
Does that make sense?
absolutely? And I want to pull up the images we have for you. But also, why don't we take a book that's from the Scientology book, the leg thing? No, I mean that's just an analogy we often use because one of the problems that people have with understanding and accepting mental illness is because it's intangible by virtue of the fact that this is occurring invisible to our senses. It's happening in the brain and it's happening in the nervous system. It's far easier for us to accept that someone is suffering when they have a compound fracture and we can see the bone sticking out. We don't question whether or not they're suffering or feeling pain because we can see it. It's tangible to us.
Yeah.
But mental illness,
So,
because it's happening in the nervous system, it's easier for people to deny it and then to claim that somebody is making it up or they're doing it for attention or it's just a crutch to keep them from doing work or bettering themselves or something. So we equate it with being lazy, for example, or something like that.
yeah. So before you bring up that image, the couple of questions I want to answer. To Crime
Here,
Curious, I saw that you asked me earlier, but I forgot to answer. I'm actually not familiar with Dr. Dorothy Lewis's work, so maybe I'm gonna have to look that up and um, come back to you on some other chat.
so you probably need to discuss Yo's
Um, okay, give me a second because I'm actually
the,
not
the
seeing this.
claim the
Oh,
claim of millions of people are abused daily, and in addition to the comment on screen.
yeah, I'm a little bit confused now
You want me to
because
read
I'm
it?
watching on the phone. Yeah, can you please read it to me because there are some
Um,
symbols just right in the
she
middle
has
of it.
she has people's life in her hands, and her observation can ruin people's future. A kid being sad can alter a growing brain. Then them saying stupid or too emotional, you can put them in a I don't know, and then the that millions of people are abused daily. So he has a belief that psychiatry ruins millions of lives.
I don't really know how to answer that. Um, First of all, I would argue there is a lot of abuse in society in general, so this is just human to human things. First off, right off the bat, like when we talk about child abuse, and by the way, let me situate it.
But hold
I'm
on,
not even talking about
let,
people
let me
being mean.
no, let me ask you more specific because I know a bit what he means. His assertion is that psychiatry ruins millions of lives.
Well, I mean, obviously I'm going to disagree with that, but I'm trying to get there. So yeah, I don't really know how to. It's true that it's very, it's a
Sorry,
lot of
sorry,
responsibility.
you just cut out on the audio. Can you repeat that?
Yeah, it's a very serious job. It has a lot of responsibility, but so does a surgeon. They're cutting into people, bad things can happen. Um, and bad things do happen, but they happen less than good things. I
So yeah,
don't
so
know.
the
First of all,
assertion when
I
we were
don't know how we would, yeah,
the,
test for
the,
that.
the assertion when we were talking the last time when I talked with Yo was when I was saying if you're not bringing the data and if we're saying empirically that millions and millions of lives are improved by modern psychiatry and modern pharmacology, and then the claim was that, essentially an equal or greater amount their lives are destroyed by pharmacology and modern medicine. And first of all, that's an empirical truth claim. I'd like to see the
Yeah.
data on that, because without meeting any burden of proof, there's no reason to accept that claim. I'm pretty sure that your position would be that, empirically speaking, modern pharmacology and medicine improves the lives of millions more than it harms. Yeah, on the
Yeah.
whole.
Okay. First of all, I seem to understand that we're talking about kids mostly now, because I see that we're talking about diagnosing kids and ruining people's life in the future. Um, Pedopsychiatry is actually quite different than psychiatry for adults. It's also a very growing field. There are several diagnoses that we're actually not giving to kids because we consider they don't have the maturity necessary to actually give them that. So, for example, we can't diagnose them with a personality disorder for those reasons. You need to have the personality established before you talk about personality disorder. Otherwise, you would end up with a lot of narcissist kids, which just makes no sense. It's just you don't have the developed brain to behave pro-socially to the extent we expect from
I mean,
adults.
I imagine maybe he's talking about something like, when I grew up, it was, the introduction of giving hyperactive kids, that's what they were called back in the day, Ritalin or something
Yeah,
like that.
yeah. Now, you know, this is a very, I mean, it's a very serious subject. I don't take it lightly. I think it's very hyperbolic to say that millions of lives have been ruined. And of course, I would need to see that, juxtaposed to the people that have been helped, because, again, you're going to have some kind of um, put those numbers on a scale if you're
Empirical
going to be
data. Yeah,
pragmatic.
yeah.
Yeah. Now, it is true. I'm actually very passionate about the fact that we don't, we're actually very behind when it comes to how we raise kids. It hasn't been too long that we have accepted that corporal punishment is not a good thing. We're
I
still
brought,
fighting about that with a lot
I,
of
I,
people, actually.
yeah, I brought that one up actually in the last conversation, and the growing mountain of evidence suggesting that it does developmental damage.
Yeah. So it is true that
Patricia said, did you see my question earlier? I probably didn't. Patricia, do you want to retype it?
I actually did. It was a
Did you?
question. I mean, actually, yeah, because I've been meaning to go back to it. I think she's referring to, do you have your own personal theory of what may work that is not used at the moment? I'm pretty sure this is what she's referring to. Um, I mean, actually, it's interesting because this is a good point to say that. I would say prevention. Maybe that's not nothing fancy. Um,
Here's
but
another assertion from Yo. Kids are punished daily in these psychiatric holds for external conflicts.
first of all, where are we talking about? Like this, there might be some country specific things that I don't know how to speak about.
Certainly not in the
Um,
West.
I, yeah, I mean, again, it's sort of, I don't know. These are very bombastic claims. I would have to see that. I, I don't know that this is happening to the extent that it is discussed here.
I mean, like
I
like
have
for
not
example,
seen it, and I
you
have not
you you
seen
work in
it
a
used like that.
you work in a psychiatric hospital. You're one of the most moral people I know. Not only would you be disgusted if you saw these people treated inhumanely, but you would go further. You would report that. So, what are the general conditions based on what you've understood and your experience as to the progress that we've made in terms of having to treat psychiatric patients according to the United Nations Declaration of Human Rights and just human dignity and modern ethics about the treatment of ill
Yeah. Um,
patients.
yeah. Yeah. I mean, again, psychiatry for kids is a little bit different. Um, I don't necessarily, it's actually a different specialty, by the way. So I'm not a kid psychiatrist. I will not work as a kid psychiatrist. Let's be clear on that. Maybe a disclaimer is good here. I will say what I said before. I do think we mistreat kids. I think actually I saw recently somebody said that basically they are the largest minority right now that is being oppressed in terms of human rights. That they're not necessarily given, we tend to put them in classrooms and sit them down. We don't give them room to move and to think and to feel. We're not really great at validating emotions, actually, as a society in general. We're not really great at that. We're learning. Um, Certainly, there's a lot of room of improvement for that. It's just this kind of epidemic described here. It's definitely very bombastic. I would like to see where we're getting, um, the information from. Like, what do we have data for this? Where's this coming from? Where's the evidence for this? Because I just know that there aren't a lot of psychiatrists that wake up and say, you know what I want to do today? I want to go and torture kids in asylums. There aren't a whole lot of people, I think, who think like that. So this is a little bit very specific, which is why I'm a little bit uncomfortable because I don't know about what places we're talking about, what circumstances. Maybe there's some kind of like specific treatments that are being discussed that I don't. But it is a very bombastic claim that I would like to see good evidence for that. Millions of people being abused. I'd like to see it.
Very diplomatic of you. So yeah, I mean, let's maybe address some other questions. Anything else that we've missed?
There's been many. I saw that Jen asked earlier about
Yeah, I mean,
what
you
would you
might want to talk
consider.
with Jen because Jen has some conditions and she is very appreciative and recognizes that her quality of life has been improved and she's been diagnosed with several conditions and so you might want to give her a moment. Jen, I don't know if you want to try to sum up any questions that you have for Dr. T while
So
she's
basically,
here.
the question I see right now is what are any tips for somebody for the first steps for someone that isn't sure about approaching their doctor, because many people keep silent and suffer alone. Like, how do you encourage people to come forward? Um, I mean, first of all, I think I would say gently, with a lot of love and compassion, confront them about the things that aren't working for them to get them to name it, like actually admit it and accept it that something isn't working for them right now. Because this kind of acceptance is necessary to ask help. If you haven't accepted that something isn't working, you're never going to ask for help. Once you have that acceptance, usually what you're going to get is a person who's trying to make excuses, move the goalpost, and have, maybe have this kind of sense of is in vain, nothing can help me anyway. And I think the best thing you can do for people at that moment is that it just to soften up this rigidity, give them a little sense that, maybe it's going to help you. You're not, you can't be sure that it's not going to help you. You don't have anything to lose. Maybe you can try it. You can always just not go back. Just don't make it a very heavy, big deal kind of thing. Just present it as a solution that exists there. You can always try it. If you don't like it, you can throw it away. And then just give them this sense that it's not as heavy as it sounds. I think that generally that's a nice way to go about it. Now, if something really serious is going on, you might need to be more stern. Like if you have somebody who's suicidal, that's not the approach I would take. I would be more assertive with them.
Now,
But for milder things, I would say that.
Melody asks a really important question, which speaks to the rather unfortunate problem of, you
Well,
know,
yeah.
capitalism and a lack of, you know, universal health care, especially in the context of America. This is less relevant in the overwhelming majority of the developed world, even in a lot of the developing world, um, and quite specific to the U.S. in terms of high medical costs and treatment, and to the extent that somebody would be willing to, try to get help or to speak with a professional and a doctor. Obviously, a psychiatrist. The difference between a psychologist and a psychiatrist is that one has an MD, one is a medical doctor. The other, it's not necessary. It's an important distinction to make. Um, so, Melody saying that she would like to get therapy, but she can't afford it.
I know. I mean, usually, I mean, the US situation to me is I don't understand it. The US healthcare thing is just unimaginable to me. I'm a European, okay, Southern European, Greece, Switzerland, but we've always had access to healthcare, and this kind of American thing just makes no sense to me. Um, but still, I would say usually, if you dig a little bit, there are some programs that are made for people who can afford it, and maybe it would be worth it to sort of maybe try and find something that might be available. There are also some other kind of tools. There are some online tools that have been
I was going
created.
to say that there are free services as well, hotlines and
Yeah,
nonprofits, and
I mean, I don't really know about the specific place, of course, that she is, but yeah,
uh, Wolf Girl
it's a
asks
big problem. I
also.
think everybody deserves to have access to it.
Wolf Girl asks also a very important makes a very important point about also being reluctant to go forward because of the traditional stigma, which I don't believe we've discussed.
Well, and we're talking about the military. Obviously, this is a very, if you have a certain stigma in the general population, in the military is going to be, 10 times that. Um,
Because then we
I
get
don't know
into a
what to say to
discussion.
that, except that at least things are changing, so that it's
Look,
starting to be better with society.
yeah, it is, but to bring up sort of also something we haven't talked about, but the legacy effect of the word crazy, for example.
Yeah,
You
yeah.
know,
Well, I mean, crazy is
as
not a
opposed
scientific term, so
No, as opposed to being, having a chemical imbalance or a rigidity within our behavior, caused by, neuroarchitecture that has become a bit less flexible because of repetitive behavior, and then often pharmacology and therapy can go a long way at sort of breaking the synapses and breaking the patterns in our behavior in order to essentially allow the plasticity of the brain to take over to at least get us into a different state in terms of our neurochemistry, which can also go a long way. So I talked with Tosh, who's a doctor, last time when we talked about this use of a metaphor. I mean, it's also literal, but the metaphor of thinking about behavior, repetitive behavior, as being sort of a fixed structure in your brain that needs to essentially be broken down, broken up, so that you can create a new neural architecture which is more conducive to well-being and functionality. So yeah, I think maybe at this point, maybe I'll show the picture, because I think it's a
yeah, sure.
really useful image for you to understand how people see physical pain and physical injury, in a completely, or other illnesses in a completely different way than they see mental illness, and how this is a sort of stigma that I think we need to overcome in order to be more compassionate and make uh, societal progress when it comes to acknowledging mental illness. So let me see if I can find the image. I'll try to zoom in on it in case you can't read it.
Oh,
So I don't know if you can
That was a
see.
nice thunder on your side.
Oh yeah, I forgot to say I might get a big storm. My computer might crash. The power might go out. So I'm going to try to zoom in on this so you guys can see this. Let me see. Let me know when you can read it on screen, and I'll just sort of go up and down. Um, can you guys read that? Otherwise, hold on. Um, I don't know. Can you guys see the first two slides? Otherwise, I'll read them. So, helpful advice. I'll read the left uppermost cell, and then I'll go left to right and down so you can see them. So we have somebody referring to someone in bed who has food poisoning, and the person says, "I get that you have food poisoning and all, but you have to at least make an effort." On the cell to the right, somebody has had their hand cut off, and the person might say, "You just need to change your frame of mind, then you'll feel better." So these are examples of physical, diseases and physical injuries that we all accept as being legitimate. We don't question the personality of the individual suffering. We simply normally accept these things as real. And yet, if they were to be responding to these illnesses and injuries like they do to mental illness, this is what it would look like. So in the uppermost cell, someone has food poisoning, and you criticize them for not trying, not even making an effort to get better. In the top right, the person is missing a hand, and this person says, "You just need to change your frame of mind, then you'll feel better." If I go down, here's
Very
somebody,
helpful advice indeed.
right, and here's somebody who's suffering from the flu, and the other person says, "Come on, have you tried, not having the flu?" And then over here on the
Just
right,
be happy.
I'm assuming that person has what? The diabetes, probably, given the picture. I don't
Yeah,
think
it's
it's health.
instant.
I don't
Instant.
think I don't think it's healthy that you have to take medication every day just to feel normal. Don't you worry that it's changing you from who you really are? And then here's somebody with bleeding from their stomach, and the person says it's like you're not even trying. And then somebody in a hospital bed, with a intravenous bag there. Well, lying in bed obviously isn't helping you. You need to try something else. So, this is sort of a really useful meme in terms of understanding how many people treat mental illness as if it's just a lack of desire to feel better. And we don't say that to people with, diseases and illnesses and injuries that we accept as fact.
Yeah, it's definitely one of my favorite cartoons.
So yeah, are there other interesting questions or other things you'd like to think about?
Well,
Because
I saw another comment from Yo that I wanted to address because it's the common. Oh, actually, let me talk about ECT first because I saw that Seasons asked that.
okay,
So there's a lot of misconception about electroconvulsive therapy. Um, I have seen, actually. Let's start with that. I have a personal experience of it. I was actually present. And of course, it's nothing like what we see in those movies these days. It happens under sedation, so you don't see a person just screaming and yelling and suffering. Um, People don't experience anything, they're sedated. There is an anesthesiologist there, they make sure their heart works right, that they breathe right. They give very specific shocks, and then they wake the person up. Um, as a process, let's start with this. It didn't seem like anything to me. It's just like it could have been any, like a surgery would seem a lot more invasive. Let's talk in terms of feelings, what it feels like to be present in it because of what we've seen in the movies. It's nothing like that. There isn't torture and suffering and yelling and screaming and all that. Um, I understand though why people are afraid of it and they might
or
be
have a
skeptical of it.
sort of visceral revulsion.
Yeah. Um, the most, relevant side effect that we actually can corroborate that happens is that people can suffer some memory loss because of it. Now, usually this is
Short term.
momentary. It lasts for like a few minutes and then you completely come back and you don't have problems with your memory. But sometimes it can be sort of more permanent, like you might have a particular gap in your memory that you actually can't remember.
Short term.
Um,
Short term.
yeah, yeah. Oh, actually long term as well. It can
Oh,
actually
okay.
be like after the fact, you have a particular gap in your memory from that day and you might remember what happened. Um, it really depends. These are things that need to be talked about with your particular doctor and all that. I can't really, I would never, it would be very irresponsible for me to say, sure, go ahead, do it or don't do it. It has been shown to help with very resistant depression. That is true. I've seen it used for that reason. I've seen people get better because of it. But in terms, again, of those scales of the pros and cons, this is something that the patient needs to choose for themselves. Um, but for sure, it's not this big gray cloud over our heads, this really terrible thing. It's like any other medical procedure with its pros and cons. It doesn't need to be any more heavier than that, if that helps.
There's a question on screen, but you were also referring to maybe something that Yo said that you wanted to react to.
Um, can you read that to me, the one on the
Yeah.
screen?
What is your opinion on claims of not guilty by reason of insanity in the courtroom? So legal question.
Oh yeah, so that's a completely legal term. It has nothing to do with psychiatry, really.
But
Um,
they do bring in amicus curiae or
yeah,
experts.
but what I mean is that it's not a psychiatric term. Um,
Indeed.
so I'm sorry. Again, I can see a part of it. So, what is your opinion on claims of?
Of not guilty by reason of insanity in the courtroom.
Okay. So
So
basically,
I think
what
I think
insanity? Okay, okay. What
yeah,
insanity means in that context is that you're not in a position to know that what you're doing is wrong. That's
correct,
what it means. You're not in a position to know right from wrong. So
correct.
it is relevant because you can say that if somebody's in a full-blown
Psychotic
psychotic
break.
break or just tripping out, if they're just seriously
Wait,
tripping out
hold
and they
on.
have no.
Hold on. I think you wanted to say tripping balls, didn't you?
I did.
In my
Yep.
room, you can say tripping balls.
Yeah, I was just thinking about, whether
But you're
I
being
want to be on video saying it.
yeah, you're, well, then I'll say it. You're being academic, so please continue. You need to laugh
I'm trying
too.
to, but yeah, I was trying to say that. Yeah, it's true. My filter got activated in time. So yeah, basically, it makes sense. It's for the particular subcategory in psychiatry where you say a person is not in touch with reality enough to understand what they're doing, the consequences of what they're doing, and the morality of it. I think it's important that it exists. I think the phrasing should start changing. And of course, there is a huge problem with how you establish those things. How can you make those arguments? How can you prove it? Obviously, a lot of people are going to be making this defense. It makes sense. It's an easy defense. Oh, I was just out of my mind. I didn't know what I was doing. It's an easy way to try and get out of things. But that doesn't mean it shouldn't exist as an option, of course.
Yeah, I just wanted to also bring up too, this belief in anti-psychiatry and how much harm it's done simply ignores. I mean, even in the room, you take the Hippocratic oath just like any other doctor. There are millions and millions of thoughtful, moral doctors who have spent their life trying to help people who have problems and to try to help them improve their quality of life. And there are just far too many testimonials, even in this room, of people, discussing how they have problems. They would like to feel better, and many, people who, you know, um, sign off on these things as having, completely improved and turned around their life to the extent that they were once miserable and incapable of doing the things that they need to do and which make them happy in life, and now they can. So if you're going to be take an excessively cynical view, you're sort of ignoring the mass amount of data of people that have been, empirically helped by not only modern medicine. I mean, we the other day we had somebody, I believe she's in the room, Veritas, a lovely person, who was talking about how she might be late to the live because she was waiting for an update from her daughter who was getting, brain surgery. And we were all worried about
Oh
her, and
God.
we were supportive. Please give us the update. And she came back with great news. And then the other day, she said she was sitting outside with her daughter at that moment, and her daughter, and they were, she felt much better, and she was saying how much she was so happy to live at a time when modern science had achieved a level that, her daughter's life arguably has been saved, and that, she can go on to live a healthy and long life, and that it might have only been 40 or even 20 in some cases, or certainly 60, 80, 100 years ago, and all periods before that, where we might have lost her, or or she couldn't have been helped. So if you're not weighing the massive amounts of benefits provided by modern science, including psychiatry and pharmacology and modern medicine, and you are cherry picking cases where medicine does not help somebody or even worsens someone's condition, or you pointing out, malpractice or corruption, none of us would ever
I mean,
deny the existence of these things because they happen, because they're just being conducted by humans. Humans can make mistakes, and humans can be immoral, and humans can be corrupted. But if you're not looking at the data as a whole, then you're essentially cherry picking. So you really need to address these things empirically and look at the data, look at the benefits against the cost. Like in every other area, you're looking at risk reward, if you're thinking about financial or economic terms. And when you're talking about modern science, you're talking about net benefits versus net failures or net harm. And you're weighing them to then, you know, decide whether or not we are improving human lives on the net, or if we are somehow doing more harm than good. But that's still it's a truth claim, it's an empirical claim, and it needs to be supported.
yeah, and obviously the simplest way to answer this is life expectancy. Nothing else really needs to be said. We have increased our life expectancy like crazy the last 100 years. So clearly we're doing something right, and it hasn't been eating better and exercising. It's been something else. What is that?
Yeah,
It's other things.
and even
It's
if
not
people will say,
natural stuff.
even if people will say something like, modern hygiene, or modern plumbing, or purified water, these are still applied sciences. They are the
it's
consequences
it's
of
still the
things that
same
we've
thing.
learned,
Yeah.
consequences
Now,
of long-term
I
investigation into how the universe works.
yeah, now I think where people get confused is that they think that this means I'm saying that we're doing everything right. We're not doing anything wrong, and that's not true. We can clearly improve a lot. That's not the point, and clearly there are problems with, with everything. We can improve. But to
See, see,
argue
see,
that we haven't,
right, that we haven't made any progress. Seasons, who is an absolutely lovely person, has something very kind to say to you on screen.
that's very nice. Thank you for being here and listening to us.
So I think I'd like to breach the topic of modern psychiatric tools, since we're talking about psychiatry, and how we can ground them in empiricism, how something like the introduction of modern neuroscience assists you in being able to do your job, and how you can go about claiming that what you do is scientifically backed and evidence based and essentially falsifiable? That's a really big question, so take your time.
Again, three big questions. It wasn't even one. So
Sorry, but
what am I answering first?
you know where I'm going. Convince
I know
us
where
that
you're going, but yeah.
convince us that what you're doing is evidence based, empirical. It can be corroborated, and there is scientific data to falsify.
Can I just quote Dawkins?
It works, bitches.
It works,
Sorry,
bitches.
sorry, I stole it from
Really
you.
does.
I
Yeah,
stole
you
your
did.
I stole your thunder. I'm so
I
ashamed. I'm so
wasn't
sorry.
giving you the line. I
I'm
was
sorry.
setting up my line. Oh my God, that was anticlimactic.
I'm a
Terrible,
narciss.
terrible.
I'm a narcissist.
You're a narcissist. Yeah, so, okay. Yeah, clearly it works. This is how we know with medicine and science in general. We've made progress. We see it. We see it with actual, um, you know, information about people leading better lives, having fewer episodes, getting out of the episode faster. All of those things are actually very measurable. That's why we have all the kind of um, experiments that we have. So all of those practices are based on these kind of informations. Really? Well, I made it with the countable.
Are you are you Greek or something? You sound like you're a foreigner.
Yeah, it's starting to get more and more difficult to get my
It is
English
late.
straight.
It is late, everyone. What time is it? Your time?
um, it's it's 40 minutes after midnight.
There's no moderation on panel, only in chat. So if someone needs to moderate me,
Yeah, exactly. Yeah, absolutely. That fashionable tank top is just gonna be down in history forever and ever.
so someone just said yesterday,
Somebody make him embarrassed. Yeah.
somebody didn't know who I was, and typed, I announced the live chat, and someone said, "Who are you? What are your credentials? Why are you wearing a tank top? And why do you smoke?" And I just said, sort of had to laugh, and I said, I'm not going to drop my credentials again. I do that too much already because I get that question all the time, and I've answered why it's really, really hot in the tropics and why I'm currently living outside because I'm selling my home and my AC broke 3 days after I put it up for sale, and I don't want to throw $10,000 at an
Excuses, excuses. What
excuses,
makes you think
excuses.
we're interested in all of those excuses?
And then the person came back. The person came back. I said, but if you come into the chat, I'd be more than happy to repeat, the things that I've said many times. You can go look at my introduction video. And she came back with, well, I don't pay YouTubers, and I don't want to go into the live. Well, okay. Who said anything about paying me to ask a question?
Thank you for informing me. And you
Because
think I needed to know that because?
Yeah. So I mean,
Yeah.
yes, I come into the chat, and you're not being charged for anything. This is all free. Dr. T is free. I'm free. Some people give me a few bucks from time to time, but that's not why I'm here. That doesn't pay my mortgage. And yes, I smoke. It's bad. Duh. Tell me something I don't know. But I just thought it was a funny question. And then, like, well, I don't go into lives, so I'm not going to ask you the question. Whatever. Who cares? And I'm not going to pay you to ask a question. What are you talking about? Anyway, whatever. People ask funny
Okay.
questions all the time.
Back to you can't really know what other people are thinking, what's in their brain. Things happen, thoughts occur. I don't know.
I'm pretty sure we're fairly open to answering questions, and we don't say, "Give me $10 and I'll answer the question." So yeah. Anything else? I mean, again, it was just I really wanted to breach the topic of how we can justify that psychiatry. A lot of people don't believe psychiatry is a science, just like I'm a social scientist. I get all the time that people don't believe that political science and economics are sciences because you can't you can't mix chemicals in a beaker in a controlled setting and control for all external variables and do double, triple blinded tests in some cases because of all the ethical problems with putting human beings to large scale sociological testing and it's just highly complex. Humans are highly complex. Billions of people are more complex. Systems are very complex. So we have to be a bit more creative because, as I often say, we don't have the luxury of spare universes with zombie identical twins who don't have nervous systems and don't experience consciousness so that we could run virtual experiments on them for different economic policies, different governance systems, and see which particular groups flourish and which, experiments lead to failed states and depravity and extinction. We just don't have that luxury. So we use comparative metrics and we take surveys and we look at historical data and we try to build models. All of science essentially builds models of the universe based on prior data, and we attempt to predict things. And to the extent that our models are good, we can predict future behavior with a high degree of certainty. Certainly in physics, we're far better at that. But when it gets into the social sciences, the soft sciences, these are still sciences in their infancy. They're highly complex, and again, these areas of inquiry provide us the potential for answers to the questions that we care about the most: how to lead flourishing lives, how to create fair governance systems where it promotes more people more of the time experiencing a wider breadth of positive experience and solving scarcity problems like poverty and illness and lack of education and all that, and just creating a happier, healthier, more thriving society. So don't be so hard on the social sciences. We're working through these things. We get better. And like for economics, for example, everyone likes to claim it's not a solid science, and yet if you look at the data, to support that claim, you have to answer why economic cycles have gotten softer and smoother over the last 100 years, for example. You can't explain that without understanding that suggests we've learned things. Economic cycles across time were like this, just massive boom bust cycles. And now we've softened that curve. So we still have cyclicality and we still have recessions and depressions, but we have smoothed that those economic cycles to such an extent that you can't explain that without appealing to improvements in our understanding of human behavior and economic cycles and a whole host of other um, knowledge claims that we've acquired in economics. The same thing with political science. This is why we lean more towards liberal democracies as opposed to monarchies and dictatorships. Now, that also has a cyclicality to it, and we're experiencing a very difficult period where we might be going through a period of regression. There is no guarantee that we move forward on a linear trajectory all the time. Sometimes we fall and we fall backwards. And unfortunately, in a short mortal lifetime, if you're in the wrong place at the wrong time, life can still be quite cruel, and you know we're working on these things. So the social sciences are just early in the process, and hopefully they acquire the solidity and the certainty that things like Newtonian physics has achieved, for example. So now I'll end rant. Do you want to comment on that? Being a Well, I mean, you are an applied scientist. You are medicine is not, strictly speaking, a science. It uses the consequences of science, but it is essentially an applied science.
So it's an applied science, yeah.
Yeah, yeah. I mean, medicine is obviously science, but when we refer to medicine in terms of doctors
Yeah,
practicing,
yeah,
we're
yeah, yeah.
talking about an applied science like
I'll
engineering
accept
is
that.
applied, well, without getting offended, like architecture or engineering. These are applied physics. Car mechanics are applied
Yeah.
physics, applied science. So you want to say something? Do you want to add anything else to the how we can assert with confidence that you are basing your practice on scientific principles, utilizing evidence? I don't know if you want to bring up how neuroscience has contributed, for example, a new set of tools. Thank you, Seasons. Very kind of you. Very generous. Thank you. I do have merch. I do have merch. I just haven't drop the link anymore. I had some before, and I'll try to get organized. I had retired for 4 months, and now I'm back, so I suppose I should get a bit organized. I'm working on getting my website back up. Anyway, yeah. Do you want to add anything
Yeah.
else to that
So
conversation?
yeah, basically it's all about how do we know about things? It's all of the
Correct. Epistemology.
epistemological things that we know. Yeah. So of course it starts with okay, we have a body. We accept the basic axioms of science, which is that if we have all the same things in a moment, the same thing is going to happen the next time. You know, the repeatability thing, because this is important. So we're arguing that things work in a particular way, and we can know that way. And then you start, you know, seeing what's wrong. You see something not working well, you try to figure out why it's not working well. You have all the different ways. You cut into it, you take images of it. You know, it's like you're using all those ways um, of trying to see what's wrong with your substance, basically. And then you try to figure out ways to make it better. Try to return it to the last, how's that called? The last functioning configuration? How's it called? You know, Windows sometimes asks you that question.
I was going to, damn, I was going to ask you a good question. Look at the chat room, and I'll try to see if I can remember it.
Yeah, so basically, I've been wanting to answer Trisha's question. Um, I think I've been procrastinating because it's a very interesting thing. It's like basically I what I think might be more used in the future. You know, what can help that isn't used necessarily. I fleetingly said um, prevention. I think in mental health prevention isn't nearly used as much as it should be. Privately, when we've had the conversations, I often talked about uh, this idea of basically everybody having, you know, like you should have a GP that's, you know, a family doctor, as we call them, who's actually you're going for a checkup. They ask you, you know, they tell you the type of things you should be doing if you need a booster for some vaccine, and I'm not even talking about COVID now, you know, or just what type of blood exams you need to take, you know, all those sorts of things. In the same way, and actually this should be happening more than it does. In the same way, I think that we should have, um, whether a psychologist, it could be a psychologist, like somebody from this area of expertise who is uh, in prevention mode with you to sort of recognize, oh, you're starting to experience more anxiety than before. Something is happening. Let's see what's happening and resolve it before actually ending up having something that you might need more of an intervention later. This kind of prevention scheme I have in my mind, of course, is not like a particular medication or something like that, but I think it's actually going to be very effective in making our lives better. And I think it's going to be like a standard of living, inevitably, at some point, like maybe 200 years from now. But I do think it's inevitable.
So preventative medicine, I think, is being proactive.
preventative psychiatry in this case.
Right.
Psychological prevention. It's the same. In my opinion, it's the same thing because body, mind, whatever. For me, it's one thing. It's. Yeah, we are one thing. We're not cut into pieces and taken separately. So yeah.
And I never did remember the question I wanted to ask you.
Oh, that's a pity.
I think it was a good one.
I'm sure it
And
was a good one.
it's gone.
It's gone. It's gone.
It's gone. So if there are any other questions, otherwise, would you like to move on to the next topic, which is relativism, because it does actually have inroads into many anti-science, anti-psychiatric. I mean, anti-psychiatry is simply another form of anti-science. It's also a form of relativism, and I've been arguing for a decade that I think relativism is the most dangerous and most highly subscribed um, ideological commitment, philosophical commitment that we have in society, even though most people don't recognize it as relativism. Um, and so, yeah, if we can maybe attempt to take on that beast, if you'd like.
What was the question? Sorry, did I miss something?
You
You
talking to
you
me, or
cut off. Yeah. Did you
you
ask
want to?
something? Because you cut off right at the end and I didn't figure out what you asked.
I just spoke for 10 minutes.
No, I heard what you were saying before. I thought you ended up in a question and I didn't understand the question. Sorry.
Are you ready to move on to relativism?
Oh, that's so funny. That's literally the part that I missed. I could see you waiting for me and I'm like, "Oh, no, I don't know what he asked."
I thought maybe you
That
were
is
looking at
hilarious.
the
Yeah, I'm ready. I'm ready.
chat.
No, 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 you literally
Okay.
cut off right at that moment and I couldn't hear you. That's fine. Go ahead.
Okay. Yeah. Well, yeah. Now I'm confused and a little um, thrown off. So yes. Now we're going to try to breach a really complex topic, which is relativism. So there are various schools, philosophical schools of what I will call philosophical relativism, and there are very sophisticated and nuanced distinctions between many of the different forms of philosophical relativism. And I'm going to try to simplify it for all of you, um, and sort of put aside the far more technical conversation about the distinctions between sophisticated philosophical relativism, but how it plays out in reality every day amongst laypersons and academics alike, and how my thesis here is that it's extremely dangerous. And I'm certainly not the only one that disagrees with relativism, and I think we share that position, correct?
Yeah.
Yeah. So I would situate all of these schools of relativism in a class of philosophy referred to as anti-realism. Anti-realism is also a highly nuanced, very complex technical discussion in philosophy that refers to many different disciplines, but it essentially is contrasted against realism. We are philosophical realists. We are realists in all senses of the word, which means we are epistemological realists. We believe there are ways to know things that are more dependable than others. We believe that we can know things in principle. So both epistemological realists as well as ontological realists. We believe that there is a reality out there independent to conscious sentient minds. Believe that the universe is knowable in principle and that we can acquire knowledge. We believe, ontologically speaking, that there is a thing called knowledge and we can define it and acquire it. And then we would also consider ourselves axiological realists, which means that we also think we can make certain prescriptions about how to live better lives and accomplish more of the things that we want in terms of self-actualization, and creating better, more flourishing societies. The easiest way to understand axiology is there is the world as it is, which is a conversation about ontology, and then there is axiology, which is a whole set of questions about how a universe should be, and this is where we get into moral philosophy, ethics, and what we refer to as the prescriptive or the normative, in philosophy, as opposed to the descriptive. So many people believe that yes, science can help us with describing the universe we live in, helping us understand how it works. But many philosophers, someone like David Hume, for example, argues that we cannot say how a universe should be. We cannot draw moral realist conclusions from the descriptive, that essentially morality is highly, if not entirely, subjective. So we're getting into conversations about objectivity and subjectivity, which we'll discuss. But ultimately, we are philosophical realists, and we have to contend with the overwhelming majority of humanity being essentially philosophical relativists. So I'm going to give you a definition from the Stanford's Encyclopedia of Philosophy, which is my
Are
go-to.
they? Why should I care what they say?
Yeah, you'll have to take my word on this, but it is the best source of information on the internet as relates to any and all philosophical questions. And I know that most people think philosophy is just armchair philosophers going, I think this and all that, but it's not. Philosophy is essentially
Well, you're a
engaged.
patio philosopher right now, so
I'm a rattan couch philosopher. It's not. This is not an armchair. I think it's rattan or synthetic rattan. But a lot of people have some very unsophisticated anti-intellectual ideas about philosophy. And yes, there are armchair philosophers, and historically, a lot of bad philosophy. There's a lot of bad philosophy all over the place. But if you believe in something like critical thinking and that it's actually a rational and logical set of tools that can help us try to figure out how the world works, critical thinking is philosophy. If you're a fan of formal logic, like Aristotelian logic and all of the modern updates in formal logic, then you are a fan of philosophy and believe that it can provide tangible and objective results, and that you believe there is something here of value. You look like you want to add something.
yeah, I remember a meme that I really liked. So somebody says, I don't think philosophy is important. And so the other person asks, well, why is science important? And the first person starts saying, well, science is important because the other person cuts them off, and you're doing philosophy right now.
Exactly.
That's it.
So,
You're
so,
doing
so,
philosophy, dude.
so about
You fell right into my trap.
exactly a decade ago, we had to confront a bunch of very well-known scientists, people whose names you will know, people like Neil deGrasse Tyson and Bill Nye, who's actually an engineer. He's not a scientist, but he's a very well-known science communicator, and a whole host of other very well-known scientists mounted an assault on modern philosophy, claiming that it had, over the thousands of years, it had provided nothing of tangible benefit, and that we should sort of do away with the exercise. And the irony of that entire thing was, how would you go about trying to refute the value of philosophy? And boom, you own them because they're doing philosophy.
They're doing philosophy. Good luck
And
with it.
and and I always say science is simply a subset of philosophy. They are both engaged in the same exercise. So if you want to discuss them separately, yes, there's a scientific faculty and there's a scientist and there's a philosophical faculty and there are philosophers. And yes, they are different domains, but I argue that science is simply a certain type of epistemology, a certain set of methods and tools to go about trying to figure out how the universe works. Well, that's what philosophy does as well. It just does it through pure reason and utilizing our best knowledge of how the universe works. So they are engaged in the same process. The same project. They just go about it with different tools and in different ways. So the famous quote, well, Robert Sapolsky is always the person I use. If you want to know quickly what we can say about human nature and what we know in modern science via one source, just go watch Robert Sapolsky and read his books because he's a great single source and he's a really moral human being and just a lovely individual, one of my intellectual heroes. And if he's not one of your intellectual heroes, you're going to have to fight me. So,
Subtle.
so
I like that.
subtle. So where was I saying? You see, as soon as that's why I can't read the chat room. As soon as I read the chat room, I completely lose where I was going. So the argument that I like to distinguish between philosophy and science, I consider science a subset of philosophy, a domain of philosophy, and I like the quote, "Science is philosophy at work." So if you like critical thinking and you like logic and skepticism, um, you're doing philosophy. Scientific
Dare I say
skepticism,
science is applied philosophy?
absolutely you can. Absolutely. So I am a
Are you
scientist.
sure nobody's going to arrest me or something? It's not illegal to say that.
I'm
Are you
pretty
sure?
sure. I don't believe it's against the terms of service of YouTube, but I have not read the fine print, and I'm not going to pay a lawyer to interpret all that legalese for me. But I am a scientific skeptic. So is Dr. T. That means that we utilize modern formal reasoning, and we um, defer to science, scientific knowledge, and the scientific method as the best way to evaluate any and all truth claims. And of course, scientific skepticism can be brought to bear discussing moral philosophy for the same reasons. That essentially it can be empirical and it relies on formal reasoning. So, all that aside, hopefully I've completely bored all of you and you have no idea what I'm talking about.
I can see a lot of puppy dog tilting heads thing going on.
Okay, so to support my case and to hopefully convince you that I am not just whistling Dixie and making things up, and that actually nothing I say is necessarily very controversial if you've simply spent the last 30 years reading a lot of philosophy of science and classical philosophy. So I'm going to read from the Stanford Encyclopedia of Philosophy on relativism, and it will be a brief introduction to the topic so that, again, I don't overwhelm you with the more technical aspects. I hope you're not bored. So let me actually share it on screen. I'm glad you're not bored. I'm always, as a science communicator, science and philosophy educator, I try to get better at, I don't want to say dumbing down because I don't want to insult anybody, but part of being a science communicator is trying to use your best language skills to make something highly technical, accessible, and digestible and interesting if possible. So if you can see that, this is the Stanford Encyclopedia of Philosophy, and I think I'm just going to read maybe just the first paragraph. So, relativism, roughly put, is the view that truth and falsity, right and wrong, standards of reasoning, and procedures of justification are products of differing conventions and frameworks of assessment, and that their authority is confined to the context giving rise to them. More precisely, relativism covers views which maintain that At a high level of abstraction, at least some class of things have the properties they have, e.g., beautiful, morally good, epistemically justified, not simpliciter, but only relative to a given framework of assessment, e.g., local cultural norms, individual standards, and correspondingly that the truth of claims attributing these properties holds only once the relevant framework of assessment is specified or supplied. Relativists characteristically insist, furthermore, that if something is only relatively so, then there can be no framework independent vantage point from which the matter of whether the thing in question is so can be established. Relativism has been, in various guises, both one of the most popular and most reviled philosophical doctrines of our time. Defenders see it as a harbinger of tolerance and the only ethical and epistemic stance worthy of the open-minded and tolerant. Detractors dismiss it for its alleged incoherence and uncritical intellectual permissiveness. Debates about relativism permeate the whole spectrum of philosophical subdisciplines, from ethics to epistemology, science to religion, political theory to ontology, theories of meaning, and even logic. Philosophy has felt the need to respond to this heady and seemingly subversive idea. Discussions of relativism often also invoke considerations relevant to the very nature and methodology of philosophy, and to the division between the so-called analytical and continental camps in philosophy. And yet, despite a long history of debate going back to Plato and an increasingly large body of writing, it is still difficult to come to an agreed definition of what, at its core, relativism is and what philosophical import it has. This entry attempts to provide a broad account of the many ways in which relativism has been defined, explained, defended, and criticized. So that's going to probably appear on first blush quite technical, but if you did fully synthesize it, it at least is supportive of our position that relativism is certainly open to criticism, and I would argue should be criticized far more because of its widespread subscription. So, in a nutshell, what does that mean? Relativism comes in many different forms, but in its simplest form, relativism, this is the way I go about describing it, relativism is either the belief that knowledge is not acquirable, knowledge and truth. So if you think about a hierarchy of certainty about the universe, think about truth with a capital T, think about knowledge below that, and think about belief as below that, with truth being our aspiration and knowledge being at least our best tentative understanding of how the universe works, but we don't have the certainty to claim that it is truth with a capital T, and below knowledge you have mere belief, what we all just think from our gut and from our own private Idaho in the brain, how the world works. So essentially, what relativism means is that you either believe that in principle, knowledge and truth are not even acquirable in principle or in practice, or you believe that maybe knowledge and truth exist, ontologically speaking, objectively, but that we as mere humans, because of our cognitive foibles and shortcomings and lack of access to all of the information, that we as humans cannot claim to know anything at all. So it's essentially claims about whether there's an objective world out there, independent of human minds. So the old line, does a tree actually make a noise when it falls in the forest if there's not a conscious sentient mind to hear the sound waves? And of course, Dr. T and I both understand physics enough to recognize that the tree indeed emits sound waves, and therefore sound is just something based on human senses, but that indeed it creates the waves which produce the sound in human, the human sense of hearing. So, and in the context of whether humans can acquire knowledge, I think we should be able to notice all around us our knowledge at work. When your car engine breaks down, it's not random or arbitrary that if you bring it to a really good car mechanic, you may very well drive away in your car suddenly functioning. That certainly suggests that we understand certain things about physics and combustion engines and how to repair them. Televisions can be mass produced and they work for human beings all over the world, regardless of their language, their culture, their subjective opinions. It works, and we can corroborate that it works in a similar way. We have GPS that dictates a geopolitical, a locational, geopolitical,
Nice.
geo geographical location on this planet, and if everybody types in a particular location with a very high degree of certainty, with a very small margin of error, which has to do with taking into consideration Einstein's relativity and the curvature of time-space, and satellites beaming information back to locate geographical points on our Earth. And if everybody was to go to the same spot on Earth, we would all find ourselves in the same location. That certainly seems to suggest we know something about how the universe works, and physics, even including really complex things like the curvature of time-space and Einstein's notion of relativity. So, would you like to jump in?
Well, the problem is with the unfalsifiability of it. You could easily then say that we're all sharing the same delusion,
You
or
could,
that only one of us exists.
correct, and
Because of
obviously
course,
to test to
there's
test.
always a way to move the goalpost in
Well,
order
and
to
that's
say
that's
that.
why I have a brain in a vat, to make sure that we give a nod to philosophical skepticism, so that we recognize that we may just be all in a brain in a vat, an experiment in some alien lab somewhere. You are all a delusion occurring in my brain. We are all in the matrix. This is all a simulation, and that we can never get outside of our existence to look back in to see if there's something else outside, or to really understand exactly what all of this, what the nature of all of this is. And of course, I think we have to begin somewhere, just practically and morally. And I
Yeah,
think that it's fair to accept that because of the widespread corroboration of universe, that even if our brains are only creating an approximation of the outside universe, that the fact that we corroborate so much on it is strong evidence, and we would obviously need other arbiters, other sentient brains that are not like us.
yeah.
Or I often use the example of animals also bumping into rocks, suggesting that the rock really is there, even if it's not as complex as we are, but it's
And
still a piece of biology, so you can still make the same argument. No,
I
please,
like that you just sped up there.
please.
Just get those last few words out. Um, yeah, I was also going to add repeatability also is a very big thing. So the fact that I can pick up a pen and drop it and it just falls down every single time, it never floats. Um,
And we can
it
predict
just,
the future.
exactly. And you can think about whatever is a simulation in our experience, like dreams or computer games, they glitch out, they're not consistent, the rules are not very, um, repeatable. They tend to change and not be that consistent, especially for dreams. If we're talking about some sort of, hallucination or something like that, computer games are better in that sense.
Yeah,
But yeah, like hallucinations or dreams, they're not consistent. The laws are not the same. They change. So if this is a simulation or something like it, or like a mass delusion, it's just too well manufactured, too self-consistent, to the extent that it makes it irrelevant to treat it as a simulation.
and by the way, the simulation theory, I always forget that guy's name who proposed the idea, but it is the basis of the Matrix. So when you say, are you talking about the Matrix? Yes, because the Matrix is based on this idea in,
Yeah.
in philosophy. So I forget what that guy's name is, but he's the famous proponent of simulation theory. And actually, there are scientists today, because we could argue that it's unfalsifiable, therefore there's no reason to accept that this reality is not real, because all of these other claims are truth claims which need to meet their burden of proof in order for us to accept that those assertions are true. But there are actually scientists who claim that they could subject simulation theory to experimentation because they suggest there may be glitches, very much like you said, in the universe, which might suggest, therefore, that we are in something like a simulated reality, very much like a computer game or a program. Interesting, but I'd like to see the data, and until I see the test and the
I
and the
though I agree with Jen's comment. It's such a big structure that I would expect more glitches. Like computer games glitch out all the time. It's like, shouldn't we be seeing more glitches? Now, of course, people would argue a lot of things are glitches that we don't accept that. Like simple coincidences, for them they would be glitches. The sense of the Matrix, feeling like you've lived the same moment again, they would argue that this is proof of something. Or whatever supernatural experience, they would argue that this is a glitch. So it's also a very hard thing to pinpoint. Now, I'm guessing that the scientists are talking about actual physical, in the physical realm, not feelings. They're talking about
no, we're
actually
talking about
seeing
data. Yeah.
places that are,
For
like the
example,
laws of
little
physics don't work. Blue holes, black holes. Sorry, blue.
correct, correct. We
I
would
made them blue. I painted them. I don't like
we would
black holes.
identify certain phenomena or certain parts of space where suddenly the laws of physics seem to be not working the same way. Now, of course, that also could just be a gap in our knowledge. Will learn about possibly locations where the laws of physics behave differently. That doesn't necessarily suggest that it's a simulated universe. It might just be an ignorance in our knowledge of physics. But if they could show there were some weird anomalous phenomena, it might be partially supportive of this sort of hypothesis. Um, so yeah, in case you have anything else to say, I hope. Does anybody want to stop and ask me what the heck I just said, or are we? Can I move forward? And do you understand at least how I've set up the conversation or the definition of relativism for my purposes today? I'm sure I've confused everybody, right? You're not confused, are you? And we've only had these
I'm not
conversations
confused, no.
a
I
million
mean, I'm
times,
permanently confused, but it's not because of you. It's just my state.
and I'm a narcissist and a communist.
Well,
Even
okay, yeah, that's true, but this is an important comment. Bring that comment up. You know which one I mean.
no, I love
It's got the
dreaming.
buzzword. The buzzword.
Sorry, you have to help me out. I can't
What
read.
does purple taste like?
Qualia. We're going to talk about qualia. You're
Yeah,
better at
but purple. It
Okay,
says purple.
okay. Well, you
I
need.
don't
I
think
know.
you're
By the,
understanding
by
me.
the, no, no, I do. First of all, she loves purple, and we have an inside joke that you're not privy to, which is that the Muffin Boy and his crowd are all pushing the notion that any image or any background purple color is indicative of child trafficking. So the fact that you
Oh,
like
I'm
purple
screwed.
and the fact that I have a
Oh,
purple
I'm totally
guitar,
screwed. The
yeah, and I have a
chances
purple
of
guitar,
me having purple in my background, actually, I don't know why I don't have purple in my background right now, but my chances are very high. So yeah, I'm screwed.
right? We're all screwed, and
Yikes.
we're all on the hit list of the Cretan
Yeah.
Squad, and Tumbleweed.
Yeah.
But I don't know if you want to address it. First of all, you're being silly because you love purple and you need to talk about purple. But
I'm
you
I'm I'm
also
over it. That's okay. I'm over it.
no, no, but I would like you to talk about qualia because you're better at talking about qualia than I am. But I don't know if it's going to be relating. I can't find it again. Anyway, do you want to talk about
That's
qualia for
okay.
a
That's
second?
fine. Well, yeah, basically, qualia is a unit of experience. Um, it's what we have in our senses and our experience of the outside world that we don't have any way of exporting or
Uploading it to another brain
measuring
or uploading it to
or,
another brain.
yeah, exactly. So it's basically not just when we talk about things, we talk about their shape and their color and all that stuff, but the actual experience of seeing something that has a particular shape, or
or
the
quality,
experience of listening to music.
I was just going
What
to
did
say,
you say?
or quality.
Or quality, the quality. For example, you're touching something that is, velvet. The quality of that, the sense of that velvety thing, that
Right.
thing is what we call
The
quality.
line that we're all referring to, purple was brought up, but the famous line is, "What does red feel like?"
I mean, yeah, there are a lot of different versions of that, but yeah, I've heard of that too. So yeah, it's a very interesting thing, because what we do is that we corroborate with each other. We use the same words for the same things, but you always have the question. You can't prove that we're actually experiencing it the same way. You can only prove that we teach each other to use the same name, the same um, sign for a particular thing, but we can't prove that the actual experience of it is the same.
Right. And so,
Just
so
that we have
essentially,
agreed to call it the same.
so this is used, by the way, in relativism, relativistic notions of reality, in the conversation between subjectivity and objectivity, and whether objectivity is even possible to achieve because we have different experiences of things. And this is where I disagree with what's his name, the guy that believes that
Um,
consciousness is the only non-emergent
it starts with a
phenomenon.
CH. Thank
Chalmers,
you. Yeah.
whose studies, he's a big guy in the consciousness studies space, somebody that I disagree with, although I respect it immensely. So my answer to the qualia suggestion that this proves everything is subjective and we can't know anything objectively because this is used as an example of something we could never um, understand, is that I disagree. Simply, an advanced neuroscience would simply be able to take a picture of a brain and say, this is one brain experiencing red. This is what it looks like in that brain. This is another brain experiencing red, and the brain patterns might be different. And so, if you want to say, my experience of red is different than yours, okay, but we could still explain the subjective experience of red in different brains, objectively speaking. This is what the brain is doing when this individual is experiencing red. This is what the brain looks like and doing in terms of all of the subatomic particles and all the neurons and all the neuronal the
I
synapses.
don't think it gets you there, though. What you need to get there is to be able to experience somebody else's experience. That's the only way you could ever
Right,
corroborate
but I'm saying
that you have the same
in
experience.
a future science, you could upload the brain architecture in theory, the brain state in theory to another brain, and then essentially create the identical simulation of red in another brain in theory. That would be a way to overcome this alleged assertion that it's purely subjective.
Yeah, or again, some people say maybe we'll develop better language or something like that to describe things. Maybe if we had a better way to describe things,
Yeah.
we could actually get
I, I
there.
I always use this line when somebody says, "What are you thinking? What are you feeling?" I just always say, in a future world, I can just show you my brain if we completely understood the brain. I could just say, this is what I'm feeling, show you a schematic of exactly what's occurring in my brain, exactly the neuroarchitecture, all the neurons that are kicking in, and all of the regions of the brain that are being utilized for that experience. And then I would say, and I'm no longer feeling that because that's a snapshot in the past, and I'm already feeling something different. So this is what I am at this moment in time. And you asked me what I was feeling at a particular nanosecond time. Here's the screenshot. Boom. That's what I'm feeling. It would be represented mathematically.
Yeah. I would like to ask Villanelle what kind of synesthesia she has,
Yeah, we talked about synesthesia the other day because I used to
because I
think
don't
that
have it, and I have to say
I don't
I'm
either.
kind of mad about it.
Yeah, and I used to believe it wasn't a thing until I realized it was a thing. I was wrong.
Oh, You
I,
were
I thought it was
skeptical
so
about it, like it was just
absolutely somebody was making stuff up, or they were, you know. But I no longer think that. An example of where I changed my mind because the
was it
data was compelling.
described and I missed it or not?
Yeah, it's
I don't think I missed it.
senses being confused, where the normal sense that we associate with
Yeah,
an
it's like a
experience.
short circuiting, and then yeah, you have two senses getting combined, or maybe even three in some rare cases. In
Yeah,
some rare cases. Ugh.
hearing flavors or something like that.
Yeah. Seeing sounds is a very common one,
Yeah,
and
seeing
hearing
sounds,
colors.
hearing
Those
color.
two things are the most usual to get combined,
Indeed,
I would say.
indeed.
Yeah.
So again, going back to this complex topic of relativism, why I think it's so bad. Let me start out with essentially, and if you understood that chapter, that those paragraphs that I was reading from the Stanford Encyclopedia of Philosophy, you will have noticed that it referred to tolerance, essentially excessive tolerance, excessive permissiveness, I believe, was also used. So essentially, that you can't claim to know anything, everything is context specific, that we can't claim to know anything objectively without understanding the context of something, and essentially that, again, at the bottom, it reduces to not being able to make objective claims or to be able to differentiate between ideas and beliefs and moral positions, and to simply suggest that morality is purely subjective, reality is purely
I
subjective,
mean,
that all claims are on equal par. And I've talked about it in The Revenge of the Layperson that essentially we live in a post truth period where opinion has basically been elevated to the level of knowledge. And before you jump in, that I just want to add that tolerance is a relatively modern value that is very, very important. It's very fundamental to modern moral reasoning, and is very much central to the Enlightenment project that we've been engaging in for the last few hundred years. And tolerance is a wonderful value. It's something really important. We should all place importance on the value of tolerance, but there is a radical form of tolerance which can simply lead not only to intolerance but to an incoherence as to um, you know whether or not we can say how the world works. And so when we get into radical forms of relativism, essentially people are arguing that we can't know anything, we can't assert that science is doing anything objectively beneficial, that we don't know nothing about the universe, and in the words of Terence McKenna, we can't tell the difference between shit and shinola. And then please jump in and before I go further. I might even play again that
yeah.
Terence McKenna short video.
I think it's important to remember where we came from. Like this was the answer to the very strict and invasive treatment we had of the other person. And for centuries and millennia, what humanity has been doing is that, oh, the people over there are different from me, and so they're
Let's kill them.
wrong. They
Let's
lived wrong. My life
and
is right,
and let's kill them.
and their life is wrong. So either convince them to join me, or let's kill them. And that has been basically the winning philosophy at the time. There were exceptions, but this is how most of human society, human history has played out. And at some point, we developed this kind of social consciousness at some point, and we went, oh, you know what? Just invading other, people's lands and go and tell them, oh, actually, your life is wrong. Your houses are wrong. Your way of life is wrong. Your food is wrong. Maybe actually, we're not in a position to say that our life is better than theirs. So it comes from a good place. It comes from a
It's
place of,
absolutely,
yeah,
and that's exactly my point.
of peace. So
This is
that's good.
correct. This is definitely not to suggest that we should abandon the value of tolerance. On the contrary, Tolerance is
It's just that then we get so far away that we basically just neuter ourselves. We become completely incapable of having any opinion about anything. And
correct,
that
and
really
and
makes me,
and
it confuses me,
taking it
honestly.
to its logical conclusion, we should know we should never challenge anybody on any belief, and we can never claim to know that this is a better way to fix a car engine than that. This is a better way to live a flourishing life rather than that. That modern medicine, is just as effective at treating an infection as a shaman and throwing chicken bones on the ground
Just
and terror
basically everything goes, a complete free for all of ideas. And
and all
clearly
ideas are.
that can't be the case. You know that when when you're staring at an exam, there are more ways than to be correct. Just you
Indeed.
know
So
that there are so many
it
ways that you can answer a question wrong.
correct. So radical relativism leads to incoherent ideas like all ideas are equally plausible or equally effective at solving any particular problem. And clearly we all know. I mean, the way I always say it is that we are all realists individually because we think we know how the world works. We think our moral positions are correct. It's only when we get challenged that everybody suddenly becomes a relativist.
When
Go
it
ahead.
comes to the children, they all know what's best. So where does that end?
Yeah. So you believe in alt
I,
med,
I
and
think you should
you
take that comment down because it's for somebody who just walks in and sees that pinned comment, it's a little bit
I
disconcerting.
I always make that mistake of leaving comments up too long. But
A
yeah,
little
I mean, obviously,
scary. We're completely off context right now.
yeah. So people that believe in make the appeal to nature fallacy, the all natural fallacy, and the sort of appeal to alternative medicine and pseudoscience. These people all take their kid to the ER when they break their leg or they have an infection. They don't tend to call a shaman or a psychic when push comes to shove and someone's life is on the line. When someone has a heart attack, most people don't call a shaman or a psychic or a dowsing
I
rod
mean, pretty much
person.
nobody does. That's the
Pretty much
fun
nobody
part.
does. So this is
So
highly suggestive.
for the serious things, you always call 911 and you trust
Right.
whomever answers. But for
And
anything
the
less
same,
than that, anything
correct.
goes. Any YouTube creator with, 3 videos is just a very convincing source.
Jen is quoting Plato in the room. Sorry, Socrates. So yeah, so we know that people don't truly believe in these things because when their car breaks down, unless they're very handy, they call a car mechanic. When their washing machine breaks down, they call a washing machine repairman. When their plumbing gets clogged up and their water goes off, they call a plumber. When their electricity grid goes out and they can't just replace a fuse, they call an electrician. When their kid is really sick, they call a doctor. We know when push comes to shove, we believe that we believe that knowledge is actually an objective thing, and that we go to when we get sued, we call a lawyer. I mean, I could just go on and on and on and on about how we don't really believe that all ideas are equal. We don't really believe that opinion equals knowledge. We don't believe that gut is the same as knowledge, although in many cases people are contradicting themselves because they do believe that their gut feelings and their intuitions rise to the level of knowledge or are superior to knowledge, as if we don't actually already know these things. In many cases, it's simply ignorance. They don't understand that we do know, and they just haven't explored what humans know about things. Um, so yeah, but relativism, to a certain extent, I mean, it predates our modern understanding of tolerance, but tolerance in its modern form often um, reduces our ability to be rational and logical when it comes to evaluating truth claims, because we can fall back on this tolerance value to say, who are we to say that, an example of, for example, cultural relativism. If I say to you, who are we to say that sacrificing a baby to improve crop output is bad? Who are you to say that? How can you know that? Who are you to say that burning women at the stake or drowning them is bad when it comes to curing disease or curing economic downturns or plagues in the village? Who are you to say that people that burn witches and sacrifice babies and throw homosexuals off buildings or throw battery acid in the face of young girls who just simply want to go to school and learn how to read, who are you to say that that's bad? These people's cultural norms, these beliefs they have the right. We should be tolerant of people to gratuitously kill somebody if they want to feel what it's like to kill someone or eat a baby. Who are you to say that it's bad to eat a baby or perform all of these odd cultural rituals? And the answer is
I mean, I'm sure it's nutritious.
might be. I don't know. I mean, in a pinch, you
Yeah.
know, in a pinch, I suppose it might be justifiable. But the point being that people make these sort of incoherent, ad absurdum arguments because of the appeal to tolerance, which just don't make sense and are essentially very immoral positions. And we would not have gotten out of the cave had we not been critical of what we consider bad ideas. That's how we make progress, is by
I mean,
criticizing
again,
ideas and
obviously, you
subjecting them
started
to. Go ahead.
you've started using examples. I'm sorry, but the comments are just completely throwing me just off course. So basically, you've started talking about morality now. It's like, is there something qualitatively different between having a broken fridge and talking about morality? Um, and I think, again, it's important to remember where we've come from. We've come from societies that have been very, very, very um, controlling and with very strict rules about how to behave, how to express yourself, how to present yourself, and all that. So it's kind of hard. Even the freedom we have now, it's so much more than anybody has ever had in the history of our species that is difficult for us to keep in mind and recognize it. So the fact that we have this variety of clothes now that we can wear and mix and match, and there are not particularly strict rules about it. I mean, you're still not going to go, you know, in a bathing suit at a wedding, unless it's a beach wedding, I guess. But there's just so much, and it used to be that clothes were for status and gender and age and just all sorts of things, very, very strict about exactly what you can wear and not wear. And we don't recognize the freedom we have now, what that means. So, of course, because we come from this very controlling society, we've tried to win that freedom, and then that ended up getting to the point of just being unable to stop. So basically, you go, well, why can't people wear the clothes they want to? Why can't they do the jobs they want to? Why can't, women choose to work? Well, why can't they burn witches at the stake if that's what they want to do? It sort of escalates this kind of way in people trying to push against that. You can't tell me how to live. I want the freedom. I don't want anybody to tell me how to live. And you can almost see the ability to put the brakes on this type of thinking.
Well, and that's my point. It's like with all, we often use the Sam Harris conversation about lying. Generally speaking, we consider lying to be not a great way of being in this world. Not a behavior that we want to promote. And yet, I always use the example that there are exceptions even to wonderful, enlightened moral positions. Like, obviously, lying is bad, except when you're in 1938 Germany and you're hiding a family of Jews in your basement, and the Gestapo knocks at your door and asks you the question, are you hiding Jews in your basement? The most moral decision, the most moral response is to lie. So lying is bad, but there are exceptions. Tolerance is good. So intolerance is bad, but there are exceptions to intolerance. We should be intolerant to people throwing gay people off of buildings. So you are sort of playing counterpoint to me to make sure we recognize what we're not saying. We're not saying be intolerant. We're not saying abandon the value of tolerance.
It's more
We're
about
simply saying
history, just to remember why
absolutely
we have come
where
to
we
this
came
point,
from.
not necessarily.
Absolutely. So the argument is simply to compare moral decision making to non-moral decision making. There are there are better ways to fix a car. There are more ways to not fix a car than to fix a car. So there are more ways to make a television. There are less ways to make a television that work than make a television that doesn't work. We could make a billion trillion different ways to build a television that doesn't work. There are far fewer ways to make a television that works, and it requires that we know a thing or two about cathode rays and LED and physics and quantum mechanics and all sorts of very complicated engineering that I don't understand. And in the same way, just like there are fewer ways to build a television that works and more ways to build a television that doesn't work, there are fewer ways to lead to human flourishing and, on moral questions, and there are far more answers to moral questions that don't lead to human flourishing and thriving societies. So there are better ways to be in this world when it comes to creating governance systems and interacting with other human beings and getting the things that you want out of life, quality of living, standards of living improvements, things like that. So to bring moral questions along with more simple non-moral questions, because that's where we always end up getting tripped up, is in all of the complexity of moral philosophy. And you and I both agree, even though we're moral realists, they're very complicated moral questions that don't have seemingly obvious single answers. So where we begin is by at least getting rid of the moral answers that we know are wrong. Sacrificing children to improve crop output, burning witches to stop disease. We've learned enough about germ theory and about human well-being and about agriculture to know that probably not a good moral decision to sacrifice a baby or burn witches. So you use the easy cases and you whittle away until you get to the complex moral questions in the context of morality. And then we have to have very complex debates where we may not have a really solid answer, because moral philosophy is all about understanding all of the consequences of our beliefs and behavior all the way downstream. So all of the possible consequences that can come from holding a particular belief or promoting a certain moral behavior, but without being able to know strongly with confidence what all of the downstream consequences of very complex moral decision making are, it's very hard to have a strong position when we get to these far more complex moral questions. Yeah.
Yep.
So simply the notion here is that there are better ideas and worse ideas. We should be able, you simply need to concede that point to me. I think everybody would agree. There are better ways to be in this world, and there are worse ways to be in this world, and that we should be able to call out ways that are clearly going to lead to failed states, failed health conditions, um, you know, uh, depraved societies. Not all answers are equivalent. Some are far better based in reason and evidence than others. Not all opinions are equal. There are some opinions that are far better informed and founded in fact and sound reasoning than others. That's all you need to concede to me, to where we can find some agreement that we shouldn't be out there saying all ideas are equal, they're all equally probable of producing good results, and that we can't criticize ideas because it's intolerant to do so. And this is where we get stuck up, because again, back to that reliance on a wonderful value like tolerance. We should be able to talk about all beliefs, whether moral or otherwise, and then simply try to identify which are more effective at getting the things we want, whether it's getting things we want in science and technology, understanding how the universe works, or being able to create better governance systems, economic systems, or uh, more dependable moral behaviors. And then I'll stop because even you're glossing over. So you look tired.
It's 2 in the morning, so things are
Okay.
starting to get hard. I was just I had a funny thought. There's an artist actually that said, I don't remember who, that if art is ready not when you can't add to it, but when, ouch, everything all right?
Yeah, I knocked over my fan because I
Of
put my
course,
feet up on it. Of course. Sorry about that.
of course, something would fall.
Sorry,
I'll blame Newton for that.
I'm a narcissist. I wanted to interrupt you.
You're a spaz narcissist. Okay, so yeah, that a work of art is completed not when you can't add to it,
When you
but
can't.
when there's nothing left to be removed from it.
Right.
So there's something about it that I like very much. And in the same way, it's like remove all the bad ideas, the obviously bad ideas, get them out of the way. Let's not, there's no point in nitpicking the type of things that are sort of the same, whatever. Maybe we don't have enough information about it. But it's like when somebody comes up with a really, really bad idea and they come up to the table and they want to sell that idea to you, you should just be able to go, no, just no.
Right. Like I
I think
said,
you did.
we,
I think
we
you did
don't
get
need
phased.
we don't need to spend much time giving equal time to a flat earther. We shouldn't waste our time giving equal time to someone who says, you can't tell me, what's the best way to treat homosexuals? Well, you throw them off roofs. We shouldn't give that idea equal time at the table when we're
There's
discussing
nothing to
moral
talk
philosophy.
about. You've
There's nothing
just
to talk about. And it,
discredited yourself.
and
So
if you say
bye.
that, and it's not bigoted to suggest that somebody arguing that it's good to throw homosexuals off of rooftops or throw battery acid in the face of a young girl because she wants to go to school, you're not being intolerant. You're not being bigoted. It's simply a bad idea. We should be able to agree that, objectively speaking, these are bad ideas. Throw them on the heap of bad ideas that we've already agreed upon, um, you know, through trial and error across time. Like I always use the simple example: if anybody wants to debate me as to which society is going to lead to more human flourishing, a society that permits and even promotes gratuitous murder without sanction, or a society that 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 looks down upon sanctions and renders illegal gratuitous murder. If you think that we can't say which society is going to produce more flourishing, happy, healthy individuals and even a more functional species more likely to survive for a bit longer between the two, then, in the words of Sam Harris, I don't think you know. I don't know what you're talking about, and I don't think you know what you're talking about.
Yep.
And unfortunately, you are starting to lose steam. So I think that rather than extend this highly complex conversation, we can either get back to it because it's an important one, and I'm not even
I mean,
sure that
it's a very,
I
very big conversation. We barely scratched the surface. We can
know.
just do it again. So much to it. There's so
Do you
much to it.
do you think I situated it decently? I mean, it's complex, but
Yeah. Yeah, for sure. It was a nice way to summarize it and present it. Yeah.
So I think then on that note, unless you have other, if you'd like to answer some questions in the chat or interact with the chat for a while, I think we'll start um, timing down to ending this stream. I might create another stream where we can still talk later, but I think I'll end this one so at least we have a more substantive conversation, because when we go into the social space and just start chatting, it's not maybe as interesting for everyone else. So I'll throw it back to you guys if you want to keep talking about it in a separate live or not. And so, what would you like to say in
Yeah, so
closing?
I would like to thank everybody for sticking around and listen to us talk. I don't take it for granted. It's always nice to be part of these comments. I did a good job to present, psychiatry. I mean, I feel like we skimmed the surface. There is so much that we could talk about. I think I did a decent job in terms of not misrepresenting anything too big. So yeah, I hope we'll do it again and we'll have more to talk about.
Yeah, so everyone, thank you for being civil and supportive in the chat room. Thank you for being kind to my guest. Thank you for the mods for keeping the room civil. I obviously miss everything, so I can never thank you guys enough for maintaining that space. Thank you, Dr. T. Your contribution is always so appreciated here, and as you know, I'm a bit biased, but my respect for your reasoning skills as well as your sort of ethical foundation. So thank you so much. I hope everybody in the room found it useful and educational, hopefully, and that you enjoyed our talk. And on that note, could you maybe kindly say goodnight to my guest, Dr. T, and let her go off to dreamland?
Have a good day, everybody.
Good night, Dr. T. Talk with you soon.
Bye bye.
So, to anyone in the chat room, I've been doing a lot of lives lately. I don't know if I'm getting annoying. If I'm annoying people, please let me know that I should take a break. But if you'd like to talk about these subjects more with me, I'd be happy to answer more questions or engage some more detail. If you'd like, I will end this stream and start a new one, but only if there's sufficient interest. There must be a lot to do today because not too many people come in. And I know, unfortunately, that when I engage in intellectual conversation, I think all of these things apply to the true crime space. And it would make me sad if you don't see how they are relevant to behavior and beliefs that are very prevalent in this space. But yes, when I do straight intellectual content here, it just doesn't get the attention because, of course, people want to see me go after dum-dums in this space. So if you like these things, please provide me with some reassurance or encouragement that they're value added if you'd like me to do more of them, because it is a bit depressing when I get, 20 people, um, you know, given that both Dr. T and I have spent 40, 50 years combined of our lives trying to read and learn about these topics, and to know that I'm basically people prefer gossip most of the time. Anyway, so if you'd like me to start another live, drop me a 1. If you have better things to do, you'd like to go enjoy your Saturday evening, drop me a 2 and say, go have dinner and have a nice evening. And there's no need for us to have cocktails 2 nights in a row. So thank you, Data Funk. I appreciate that you like both. There's a 1. I could possibly join you again shortly if you like. Thank you, Mrs. Kravitz. Very kind of you. Yes, don't you think Dr. T is lovely? She's one of my favorite people on the planet. Probably in the top two, like my mom and my girlfriend. Um, so I'm certainly biased, but it's nice to see that you guys appreciate her as well. Okay, I mean, if you want, I could come back in an hour. We could all have some dinner. I have some chicken. I think I'm going to make some fried chicken. That sounds yummy. I didn't eat the last day. Platy will be mad at me. So, yes, if you'd like, then I will go take an hour break and I will drop you guys another link for another informal. And if you have other questions that we didn't answer here, I think I lost you guys on the relativism stuff. It's a very complex topic. I hope you didn't find it boring. So, in that sense, I will sign off. This is the Brain of Et saying good evening to all of you who have better things to do. And then I shall be back in an hour. And I knew Platy would be mad at me. I did make myself some soup, but last night I was too tired to cook. So I did have some soup today. And now I'm going to go make some fried chicken. I'm glad you liked the topic. So I will see you shortly. And for any of you who have better things to do, I bid you adieu and a lovely evening or day, depending on where you are. And to any of you who decide to come back and chat with me some more, I will see you in about an hour. Good night, all, and thanks for coming. Bye.